got to go through, Amy. So
No, that's cool. That's
yeah,
cool.
the other day we pushed them out. I want to say the 23rd, but anyway.
Yeah.
Well, let's see, Judy, I've got 7:01, so
All right.
we can call the meeting to order, and then if you could just do a fast roll call.
Yep.
We're not approving anything tonight, so it's not.
All right. You want me to, all right, Neil Butnick,
Here.
Judy Neville, Tom Schulte is absent, Amy Carroll, she's here.
I'm here.
George Blauvelt
Here.
and Todd Levieri,
Here.
Chris Labrie,
Here.
Michael Chin,
Here.
Rhea Weingarten,
Here.
and Robert Hamill.
Here.
Do you want to seat Tom Schulte with Maria?
Yeah, sure.
Okay,
Yeah.
so move, or somebody should move.
Yeah, let's have a motion to have Maria please take the seat for Tom. Yeah, Amy, thanks. Second.
I'll second.
Neil, yep, great. All in favor? Aye. None opposed? Okay. Put your law firm hat on, Maria. Unfortunately, if you're gonna play Tom Schulte, you have to. Okay,
Big
let's
ass.
go ahead and get started. Linda, did you want to make any opening comments at all on anything, or should we get right over to Jen? I'll leave it up to you.
No, just process. So what I'll do before any of the departments start speaking, I'll kind of reference where they are in the book.
Yeah.
So you can follow with us, and then by way of introduction before they begin.
Okay.
So the way that the book is organized, we have some revenue schedules, and then we have the expenditure schedules, and then we have capital budgets if the department has capital budgets. And so for the health department, who's going first, their revenues are on page 5, and then the expenses are on page 13.
Yep.
And with that, I will toss it to you, Jen.
All right, so the major changes of this year, we added a position of sanitarian health program planner, Shannon, to our budget. She was previously in land use budget part-time. So essentially transferred half of that into our budget. We added a public health nurse that's fully grant funded under a grant I got, an ELC grant from the CDC to the State Health Department. The medical director position salary is also split in half because half of it's funded by another grant that I got, Public Health Emergency Preparedness Grant. So that's basically the crux of the salaries. The rest stayed the same. Revenue, we kept the same because of obviously restaurants are struggling. I'm not going to increase fees this year to restaurants or salons or anyone that's for obvious reasons with COVID and the pandemic. That just would not be the correct thing to do. And everything else is trending relatively the same regarding building permits, septic plans, and that kind of stuff. The truck inspections are the septic trucks and garbage trucks that we license every year. Those are just a flat number. It's the same number of trucks every year. So that obviously doesn't change. So those are the major changes to this year.
Well, look, first of all, you jumped into it before I had a chance. The town owes you just such a debt of gratitude and thanks for all that you're doing every day. This has just been the most amazing 10 months, I'm sure, that we wouldn't have imagined 12 months ago this would have been the case. So a huge thank you for everything. And you handled it well, and you're extremely responsive. It's unbelievable. I don't know how you do it. But anyway, a big thank you for everything.
Thank you, Todd.
This board, but also the town.
Well, thank you, Todd. But I mean, I couldn't do it without the support of everybody else, you know, the EOC team, Cheryl and Kevin, anytime I go to them with something or I got to hire temporary staff, they're always very supportive and helpful. And obviously my staff has been wonderful in the trenches with me in this kind of nightmare for 10 months. So it's been great.
Amazing. Go ahead, Amy. Yep.
Yeah, you know, Jen, what I was going to say is this is your time to spend 5 minutes and let everybody know everything you've done. I mean, because you're working out there like crazy. And I don't think everybody really appreciates what you've had to do this year. And I think people should know, you know, so I mean, you went right into your expenses and stuff, but it's your time to say,
Yeah.
this is what we do, you know, and this is what we did extraordinary this year. And I think it's important for people to know.
I do too. She wants to have dinner though, Amy, but
Oh, okay.
no,
It can
I'm
be quick.
joking. Jen, take a look, a day in the life, just in the last few months, just on that and the things you've been doing and all the, the demands and you mentioned all the support, of course, but I do think it's important to know just in terms of some of the things that you processed and you and your team, I should say, on behalf of the town. Any thoughts you have? And we don't mean to put you on the spot, but but I agree with Amy.
No, so, I mean, obviously the past year has added quite a bit to my workload. I mean, between the contact tracing, the sector rules enforcement of the establishments, to running multiple test sites, whether that was when I brought in Stanford Hospital, we handled all the registration, we handled all the results, Waveney 6 days a week, we again handle all the registration and results, staff working test sites. The vaccination clinics now are up and running. We did 300 yesterday, and it's a very smooth process. So, we do work around the clock, and then, people have to remember, we still have our regular job. I still have to go out soil testing with engineers and septic installers. I still have to do food inspections, salon inspections. I still have to do the lead case management, daycare inspections. In the summer, we do swimming pool inspections. And then when the governor added all these sector rules on top of our normal, statutory and public health code responsibilities, it just literally amplified everything. But all of that's done obviously for reasons in the disease prevention. Inspecting restaurants is all about, preventing foodborne illness and making things are handled properly, things are at the proper temperature, and daycares we have to do. So everything is, none of that stopped. So we have to keep doing that. I have soil testing tomorrow morning for 3 hours outside in the cold, so all of that continues on top of planning for the vaccines and calling all these people. I mean, especially with the 75 and over demographic, it's a lot of work. People don't see the back end of the work. We were here in the snowstorm last Monday in 18 inches of snow, called 600 people to get the 200 people, then handle all the paperwork. I have to put it all into VAMs, and then Bethany and everyone, Dr. Pierce and all my vaccinators have been great at the site, and just helping the seniors and helping the residents is really what, we're all about. And it's been great. We're still doing the testing as well. So, that's still ongoing. And, basically anything that comes up, we never know what the future holds. It's kind of how a pandemic works. I mean, obviously vaccination is going to go on for a while. So.
Thank you. Thank you for everything.
Yeah.
Thank you.
And she didn't mention helping me communicate.
Yeah.
That's my favorite part, Kevin.
Any other questions or comments for Jen? I mean, Jen, I think the budget's what you asked for and what you need. We get it. So that's perfect. Okay.
Great.
Okay.
I should ask for more, Todd.
Anybody, if there are any other questions, we'll move on. Okay. Well, Jen, thank you so much on every
Thank
level.
you.
Every level.
Have a good night.
Thank you. Yep, you too.
I see Bethany is on with Human Services.
Yep.
There are some revenues. She has one revenue item
I have
on
one.
page 6. One revenue item. And then she has some expense for departments on page 25, and she can walk us through some of the changes. Maybe Bethany just start with the revenue and then we'll go to the expense.
Okay, just want to preface a little bit. Human Services this year, we have seen twofold in needs for the clients that we have had. Our food pantry has doubled in terms of people receiving their food. That it doesn't feed everybody every 2 weeks, but it bridges a gap between food stamps and the income that they do have. So, yes, the food pantry was a big item this year in terms of getting donations and the time working. Plus, we had to let go of volunteers because of the COVID. So the human services was doing this on their own. We have brought in volunteers again. At the same time, we still are not having people come in the church. So volunteers are literally packing food inside and pushing it out in a grocery cart. They did it on Tuesday, in the snow. And we are keeping people fed, but there's definitely been an influx of needs, and we are meeting them up to this point. So the revenue we have is the one item for the seasonal flu vaccine. We have been a public health service for vaccinating since 2007. And it started out as a mass dispensing exercise for emergency preparedness. And we used to give out on one day 11 to 1,200 shots at the high school or at Sachs Middle School. And then the grants slowly dwindled, and we still wanted to keep the public health service available though. And so now we vaccinate about 330 people a year. And we do that mostly seniors who we sponsor the Lapham flu clinics, the senior men's flu clinic. We also have, you can come into the office, and we've just continued that service. So that's our one revenue. We've kept it at $30 because that keeps us in competition with CVS and Walgreens, the surrounding pharmacies. So that's the little history, and that's our one revenue. It's not a huge gangbuster, but as human services, I feel, it is definitely a public health service that we should provide. And we do home visits to those that are homebound, and they can receive their flu vaccine that way. We become a Medicare. In 2011, we became a Medicare provider. So we're able to charge Medicare. This is where the revenues come in from submitting to Medicare, and as well as the $30 if you were not a Medicare recipient, we charge. So any questions on my one line revenue?
No. Anybody?
No.
Okay. Expenses. This year, the changes, if we look at the salaries, we did hire, starting July 1st, which you kindly agreed to last budget season, a human services senior caseworker. And that has proved invaluable, especially with now that COVID has come into play. So Marcy Rand, we hired her. She was 9 years at the Darien Senior Center. And so she came with a wealth of knowledge and expertise, and people have responded to her very well. So that's been great. So the salaries have maintained, except the one item I wanted to go into is the admin assistant. I'm requesting a $5,000 increase. This is because the amount of time that the food pantry has taken up. The admin is working on the weekends. She's working at nighttime for the distributions because of the lack of volunteers that we've been able to safely have. And I've been taking this out of overtime. And instead of I don't see this letting up for a while. And instead of taking it out of overtime, I would like to give her a raise and have her be able to, as part of this job description, to work weekends, nights as needed. And so this is my way of introducing a higher pay and eliminating the overtime aspect.
So Todd, on that, just to understand the mechanics of it, because what's a food pantry related work, and therefore that 5,000 is not going to be a general fund cost. It's going to be made up by food pantry contributions. So it doesn't have any general fund budget. You'll see that there's a $5,000 credit from the food pantry for those services because those are directed to the food pantry program.
Linda, I can't say I completely followed what you said. Did everybody else get that? Maybe it was just my end. It broke up a little.
It broke up.
Yeah, Linda, you broke up a little bit. You could just restate it, but the only question I got is it, I can't see it in the line items. You're telling me I'm not going to be able to see it.
Right, so because Human Services also manages food pantry donations, which are non-general fund dollars, there are donations in the food pantry, which is accounted for separately. There's a schedule of these funds in the audit, but they're not part of the general fund. We don't tax for those funds. And so there are expenses related to the food pantry that are charged to that food pantry donation account. And the thing is this additional work that the employee is going to be doing related to the food pantry is going to be an expense that's picked up in the food pantry budget.
Okay. I think everybody is completely supportive, Bethany, of the 5,000. Is that all you need? Would be my question.
Yes,
Is
it
there
is.
anything else you need?
The community has just been so supportive in terms of donations and food,
Okay.
non-perishable. So yeah,
Okay.
this is something that we could definitely use. And
Okay.
So I have a question about that, Todd. Just, with contributions, sometimes broad organizations like Fairfield County, and then we have the New Canaan Food Bank. And someone told me at the big one that we get an allocation of that food. And I was wondering, how is it distributed exactly? Does it make a lot more sense for me just to go to give in New Canaan, or does the Fairfield County one, I forget the name of it now, allocate supply back to New Canaan?
so what we do, Neil, we take all contributions of food and donations, and we do not use Lower Fairfield County Food Bank for access of food. What we do is any of our items that have expired, what we do is we give them to the Lower Fairfield, and we get a monetary reimbursement credit for the pounds that we give them. And sometimes I think when we get up to about $1,000 to $1,500, what we do is then we donate that to person. Because person to person uses, New Canaan clients are allowed to use person to shop once a month there. So between our food pantry and person to person, someone, it does help immensely. So our way of New Canaan helping person to person is to give our credit from the Lower Fairfield County Food Bank, and they in turn use it to purchase their food, so to speak, purchasing power.
Okay, so sophisticated program.
Yeah, I thought, yeah. It's just great. It's a great way for person to person to get the access, and plus our residents are using it. So
Yeah, it sounds great.
Great.
Thanks.
You're welcome.
Bethany, how are we doing with the heating,
The heating,
the fund, the heating?
oh, yes, the warm up fund. Excellent. And the state energy assistance program, they have been very generous, and we have 60 people that applied for energy assistance, and they receive credit, and then they use that credit. If they use it up, then there are safety nets. There are 2 or 3 more safety nets. So because of this state and federal program, our warm up fund, it's very strong, but we do use it, but it's really near the end of the season when the energy assistance is depleted from state and federal.
Has that been increased from the state?
Yes, it has.
Oh, really? Good.
Mhm.
Thank
After
you.
the qualification process, depending on someone's financial situation, they're given credits, and this year it was phenomenal, and I'm sure COVID related, but we actually have not paid for anybody's heating yet.
Good.
Mhm.
Thank you.
Thank you. So going down, it was a year ago that I started and it was my first budget season. And I really looked at what was being spent and what we were budgeted, and I cut down quite a bit. So I've sliced off even more this year, fine tuned it as I get into my second year, and we've tweaked it to the point where we reached the general assistance fund, and you see that the 22,000 that's usually allocated this year is not, for this coming fiscal year. And the reason for that is there was a special projects fund that just kept accumulating. And so finance did an unbelievable project of going through since back to 2000, I don't know, Lundis, 2015 or 16, when the project, yes, and able to separate the fund from food pantry and from warm-up fund and from just general assistance. And we have about 60,000+ in there for general assistance. So the thought being, we take off the 22,000 and we use that, the general assistance, because this is donations from residents. They want the money to be used. And so I'm thinking about 3 years, possibly we could go without having a line item of, and see, and that's why it cut down the 6.3%, lowering these overhead costs. So I don't know what you think about that, but we do have that money and I'd like to use it. And with the understanding that when it is depleted, we will cap it at 22,000 a year, just like we would this line item. When it is depleted, then probably, we come up in front of the budget again to gain access to more of the line item if our special projects does not stay hefty like that.
So Bethany, you're just going to have to remind the Board of Finance of this every year for the next 3 years.
Yes, I will.
So that on year 4, we don't say, what is this profligate expenditure that
I
you just
told
said?
you so, right? No, so
Bethany, my recommendation is just get the video clip off of channel 79 for that last minute and just replay that. I think that's all you need to do. No, look, you're in charge. If that's the way you want to do it, that's totally fine with us. Makes perfect sense. We just want to make sure you have what you need. It sounds like you have what you need and you can do it that way. And if that's the way you want to do it, of course, you call.
Thank you. So what I am requesting on the plus side is going down to other agencies. We've remained flat for every outside agency that has requested grants, but the Kids in Crisis.
Yep.
So they started, I understand this agency a little more now, because what happened was we usually give them 56,000 a year. I think they usually ask for 58 or 60. This year they asked for 90. And it was sort of like an eye opener. So Harrison Pierce, the chair of the commission, he and I had a meeting with the stakeholders in Kids in Crisis, and they explained to us that Kids in Crisis started in New Canaan. So we are the poster child, and we believed in them, and through the years, they have not raised the amount for the grant. And it's actually cost about $90,000 a year for a counselor, a teen talk counselor who's on site during the school year, but all year round. It is also, if a child is in crisis, they have housing. It's a 24/7 agency. So that being said, we have been paying undervalue for years, but they wanted to keep us. The thing is now, everything is, the towns, Kids in Crisis, they are getting asked to be in Darien, other towns, and they're maxed out. We don't want to lose our spot in New Canaan. At the same time, Darien's willing to pay $90,000 to get a counselor at their high school. So we want to show by going up to 70,000, we want to show our interest that we will get up to the point where we can sustain a teen talk counselor, as well as what the other area, Westport and the other towns are paying as well. So that's why we've jumped up to 70,000. There are plans. We would like to have a kids in crisis counselor at the middle school as well. This is something that the Board of Ed has nothing to do with, and it creates a very private atmosphere for the families and the children.
So Bethany, I'm sure others are thinking the same thing. Why wouldn't we just go to the 90? I mean, you've thought this through, so we can't really micromanage the line item, but was there any, you went to 70, which is, I get it, it's fine, but.
Yeah.
Well, is the 90 the need? If it's 80, I mean, what's the true need?
90 was the request, like 89,900 and something is the request. And we just said we could not do it during a year like this. I told them we would give them another 2,000, and the Board of Selectmen said, no, we'll go to 70. So I'm excited about that. I think they said if we can just show interest that we are planning on getting up to that level, they would be very appreciative. So I think 70, they would be elated, and it would show our interest. And then the following year, I think we should be up then another hit. But frankly, I mean, it's an unbelievable program.
Maybe ask my question a different way. Are the children here in New Canaan, are they just as well off with the 70 versus the 90? I mean,
it's the same service. It is the same. It's the exact same service.
Okay.
But are we having other communities underwriting our $90,000 expense? I mean, if it costs $90,000 for them to provide these services, if we're paying under that, are we not paying?
So what we're doing is the cost of the salary is about $56,000 for the teen talk counselor. So we are covering her salary. That's what we did in the past, or his salary. That's what we did in the past. Now this bumping it into this level, we are now paying for parts of, the healthcare aspect, as well as the offsite for children to stay, the 24/7 crisis care around the clock. It's not just Monday through Friday at school. So yeah, I mean, we could suggest, I could bring it up to 90. I just thought with the year that we're having and the guidelines we were given.
This isn't what you cut though.
Pardon me?
This isn't the kind of thing we want to cut. You can come back if you'd like, but if the recommendation is 70, that's great, and we're delighted to support it. If the recommendation was 90, I'm sure this board would support that as well.
So we had a long conversation, Harrison and I did, and they said, if you could just show some interest, we are more than happy, to keep going. We don't want to lose New Canaan. New Canaan is definitely, this is where we started. Okay. And we want to stay here. And Harrison and I both said, we want to get up to that level so that we are paying for what we're getting.
Another consideration, this is a state-funded agency as well. They're a nonprofit, they raise their own funds. And so their state funding has been cut.
Right.
And we also, our community foundation gives them $25,000 for another program. So I think they look at New Canaan sort of in the aggregate, it's what we're supporting them from.
Yeah, New Canaan Community Foundation gives them $25,000 a year for the grieving den for kids.
Right.
It's a great, and also, maybe we could tap in. I was thinking maybe tapping into, I talked to Lauren Patterson, New Canaan Community Foundation, possibly, filling the gap. So I'd like to keep it at 70 and see what I can do this year. Okay. But
we're just very sensitive to it. If you needed more, I think that this board completely supports it. Leave it at that. Your decision. 70. It's great. And then, but if you said after thinking about this and you felt like it needed to go 85 or not, just let us know. It's the thing that's the right thing to do. Yeah. So we completely, of course, we support it.
Okay.
Any other comments on that, team? I don't know if anybody had any other questions, Judy?
Just a thought on, will the 70 get us the second person that seems to be needed at Saks?
No, so I asked them about that.
That would be my issue, yeah.
To get, they
Wanna
said
be-
that needs to be negotiated. They would like to see 90. And that's a lot.
I'd like to see the second person at Saks. And you know, I go back a long time with this program. We brought it in. Cheryl does too.
Did you? Okay.
Oh, yeah.
Okay.
And if it's needed, it's needed, especially in that age group.
And maybe even
Private. It's private, and that's the key.
You
Yeah.
have our feedback. You have our feedback. You know, we're not voting on anything tonight. We don't vote on it until March 4th, but it would be great to give this a second thought. And if there's something you want to do differently, just let us know.
appreciate it for your support. Thank you.
Okay.
Linda, can I ask an administrative question? With Bethany saying that they have a about $60,000 balance of contributions that you're going to be using to give out as opposed to the requesting the funds. Linda, is that as we're trying to clean up all the funds of different departments, is that somewhere that I would find it in the CAFR? Just that, or is that like a separately how, I'm just trying to, because we're trying to look department to department where there's savings accounts that we want to kind of put to work. Is that somewhere in the audit or somewhere?
Yes, can you hear me?
Yeah.
Yes.
Okay, sorry, I
Oh,
had
you're
to
in two
switch.
places. Okay.
Yeah.
I had to switch devices. I was having issues.
Okay.
It is in the CAFR. I will look through it and then I'll let you know what page it's on as we go through. Oh, actually, it's here on page 136
Okay.
of the CAFR.
Okay.
If you look at the very top, you see those special projects, human services. So you'll see,
Yes. Okay. Thank
so
you.
you see the 3 programs and what the ending balances are. So those are the funds that that Bethany's referring to.
Terrific. Thank you. Thank you.
Bethany, anything else or any other questions from the?
No, it's just been, it's been quite a year, and the seniors with the shopping program and the volunteers offering to shop for the seniors, they still are. We have volunteers that have been shopping since March for their seniors. So it's an incredible experience for many people, and we're just embracing the moment, and we'll get through it with
Thank
this
you.
COVID crisis.
Amazing. Okay. Well, thank you.
Thank you.
Great job.
Appreciate it.
And get back to us on the kids in crisis.
Okay.
Okay.
Thank
Thank
you.
you.
Okay, so
We're gonna have
now we
Larry
roll
go or-
into,
Yeah.
we roll into general government.
Okay.
And we're going to begin, since we have Larry here, with the town internal service fund. And then I'll walk through the rest of the general government departments. We do have some department managers on the call. So we keep a separate fund for internal service, similar to the Board of Ed. It's on page 40 of your budget book. And on page 40, you can kind of see the ins and outs, the pieces that make up the whole. But by far, the biggest line item there is the town contributions, which is what you see on the general fund as an expense. And it shows up in the internal service fund as a revenue once the monies get transferred in. And you'll see the individual line items that are budgeted for FY22. And these are numbers that are provided to us working with Larry. And I'll let Larry now just kind of talk us through. He has some other slides that he'll share just to talk us through the math and some of the actuarial projections that get us to those numbers. And then we can have some additional discussion about the ending balances and how the fund is managed.
Hi, everybody. Nice to see you. I miss being there in person. Hopefully won't be too much longer. Thank you, Linda. So I just wanted to go through some high-level points regarding the town employees' health insurance plan as it relates to how it's performing, and kind of do this obviously every year at this time, and certainly a lot of emphasis on the budget for next year. And you can see we've budgeted pretty much a flat number, and I will mention that here when I get down to the assumptive cost for 2022. But I just wanted to go through a couple of key points, which I think are, is important. And I know everybody's very focused on the budget for next year. And also wanted to touch on some of the initiatives that we are doing in combination with the Board of Ed, as well as we look to find synergies in our purchasing arrangement. So the last 3 years, so again, our job is budgeting, as you know. So in a self-insured plan, health insurance, COVID, tough year, forecasting health insurance claims costs, it's not easy. It's not an exact science. But the town has saved, since we've gone self-insured in 2015, a tremendous amount of money by moving to the self-insured vehicle. Here you see fiscal year, the results in fiscal year 18, we ran 12% under budget, or we ran 88% of our expected budgeted costs. Fiscal year 19, we ran 4% under. Fiscal year 20, we ran right on the number. And anything under 100% is good. And anything obviously over 100% is where we run into an amount over the expected. So fiscal year 21, year to date through January, we are running right on the number. So you can see here over on the right side, PEPM, that's per employee per month accrual or budget on the health plan. You can see that even for fiscal year 2022, budgeted number of about $23.95 per employee per month, we're only 10% over where we were. It's going to be 5 years once we get to the end of the year. It's amazing. So normal inflationary, just was reviewing something from PwC today. Inflation continues to run anywhere from 6 to 10% over the last few years annually. So our plan is running very, very well from a predicted cost standpoint. And we feel very good about that. And the town, like I said, has reaped tremendous amounts of money from the self-insured plan. The demographics, one of the things that's important is, and we talk about this all the time, and where we're a little bit different than the Board of Ed, is that, our employee base is aging, and, we're not going out and hiring a tremendous amount of, 25, 28, 29, 30-year-old people and bringing them into our risk pool. So it's something that we're keeping an eye on. Obviously, some of our people that we cover, the fire and the police, there are obviously a younger demographic there than, let's say, the DPW. But I think it's just important to know, and I'm not telling you anything you don't already know, that as the group ages, there's more utilization in services. They're just, that's just the way health insurance and medical care and use of services work. So that's something that obviously we're keeping a very close eye on. We've gotten we have most of our people now in the high deductible health plan. And I think that's the main reason for the result above, where we have people being more judicious about their care and their settings of care. And therefore the plan is running better. It's not just a credit card environment like it was in the past, where people just had co-pays and they would run out and they really didn't care where they got their MRI or where they got, certain procedures done. But in a high deductible health plan, there's more consumerism. So I think we've had a real lift there. One area that we continue to have, this is kind of the good news and the bad news. So the good news is we have stop loss insurance, and the reinsurer specific to the town plan. Here's the last 3 years premiums to claims and number of claimants exceeding $50,000. So In fiscal year 19, we had 21 members exceed 50,000. Fiscal year 20, we had 19 people. Fiscal year 21, halfway through, we already have 9, and we've built 20 into our projection going forward. So we have a very consistent group of people here that's exceeding 50,000 annual spend. The good news is that that's giving us some predictability on our costs, reference, the top number one up top. But what's happening is the severity of the high cost claimants is picking up.
Yeah.
And you can see that in fiscal year 20, we had 2,600,000 in total claims on those people for about 1,057,000 over the stop loss that we got back, and we only paid 831,000 in premium. So this year we're already in the stop loss insurer's pocket for 450,000, and we've only paid 476 in premium, and we're heading in now to the bad part of the year for the stop loss insurance company because people have matriculated towards our stop loss level of 100,000. So this loss ratio is going to look really ugly for them. The good news is it's helped us, run a very predictable program, but we are going to have a tougher reinsurance renewal than we've had in the past, mainly because the Board of Ed's experience on the stop loss insurance this year is also not as favorable it was in the past. So we've done a good job managing it. This is the area, if you recall, that we share. We brought the programs together a few years ago, the stop loss insurance and the combined premiums have really helped stabilize both the town and the Board of Ed's reinsurance cost, but we are hitting the reinsurer very hard. And we've built in a substantial increase in the reinsurance in the budget. Whether that comes to fruition, we'll see. Very important also to understand that the COVID-19, there was definitely, if you remember back in the spring, when we were all kind of locked down and hospitals weren't even performing elective surgical procedures and you couldn't go to the primary care doctor for routine visits, that suppressed some of our costs, no doubt, and helped the result for fiscal year 20. Mainly when you look at claims that were paid in May and June of 2020. We've built into our projection a kind of a return to normal load into the claims, taking into account that last year, or in the amounts that we're using going forward, we have some suppression of care. So we've normalized that. And we have not been immune to COVID claims. So we've had our share of COVID claims. We've had some very significant COVID claims. I just, as I was intently listening to all the great things that you're doing there, I think it was Jen who was talking about all the great things that you're doing as it relates to COVID. And I think it's just important to note that we've not been immune to people that have gotten very sick and in the hospital for COVID. So hopefully that, that does abate as we kind of move along through this thing. And then, last, and as I just mentioned, so the assumptive cost for 2022, we were using data through October. We'll probably revisit the data in another week or so once we get data through January. The experience did deteriorate in January, in December, and a little bit in November. And as I mentioned, we added that 8% load, but we still feel very good about the projection because, as I said, we're using normal inflationary factors, and the reinsurance has really benefited the town by having the ability to create a very smooth and predictable total cost. As I mentioned, just kind of the initiatives. So we are at about almost 100% HSA, health savings account, high deductible plan enrollment. We have moved the funding for the health savings accounts the amount down, as now we have almost total participation. So that's a savings there. We've implemented plan design changes and made more cost shifting to members where we have gone through CBAs. The last one that was done was the DPW. And then employee contributions, and Cheryl's really done a great job here with regard to getting people to share more of the costs, obviously every year as costs go up. So we've been in a good environment where our costs really aren't going up, but our cost sharing is going up and the amounts that the employees pay. And I think that's a good formula because we want employees engaged in the fact that this is a very, very expensive benefit, and they need to share more of the cost every year. And in some years, we're going to run over the projected, and we can't turn around to them and say, oh, we ran 4% over, so you have to pay 4% more. So, some of the other things that we're really emphasizing and working with Cheryl and her team with is things like virtual health. If it's amazing, right? A year ago, 2 years ago, who would have thought we'd be communicating with our providers through virtual health? That's really taken hold. And that's something that's really going to, as we come out of the pandemic, be around obviously for a long time and really move the needle on that. Mental health, really evident around all the mental health issues that people are going through in this pandemic, and just continuing to provide resources and support around mental health, whether it's the employee assistance program or their benefits through the health insurance plan. COVID support, obviously, you're doing a lot as a town, but there's a lot of communication that we do along with the Blue Cross Blue Shield program around testing, vaccines. You're starting to see a lot of information now coming out around vaccinations as the supply ramps up. And then wellness program. And I know that we've talked about that in the past, and that's something that the town does, and we support the ongoing wellness program. So that's really it in a nutshell. The Board of Ed, we are going to be looking at a couple things. One is, I know it's on a topic of conversation. I don't know for tonight, but combining the internal services funds of the two entities, looking at that, and combining and purchasing pharmacy benefits together.
Well, we're not going to. We'd love to get your input on that. Maybe the question might be, are there opportunities for savings putting the pharmacy together? And then I just happen to know on the prior page, you kind of flashed through it, but I was looking at the fund balance in 2019 was about 9%. In 2020, it looks like it's about 14, and this year it looks like it's 12. Is that an appropriate range? Call it 10 to 15 for a fund balance? So two questions. One, benefits with pharmacy, would there be some savings if they could put that together and leverage the spend at CVS and Walgreens? And then the other would be just the fund percentage.
Absolutely.
Yeah.
In fact, Epic, the firm that I work for and run in the New York office, we just purchased a company called Pharmacy Savings Group, or I'm sorry, Pharmacy Strategy Group at Dallas. And they handle the pharmacy oversight for companies like Ford, Boeing, Kroger's, Walmart, too, really giving us significant horsepower now, which we already had. But to answer your question, Todd, and I hope there's no one on the call that works for the pharmacy industry, because they're it's absolute most non-transparent thing in our society. They're absolute thieves, and these need a lot. So to answer your question, yes, there's money on the table with regards to pharmacy. And pharmacy, not to go off on a tangent, but pharmacy is a commodity, like you just referenced. If you go to Walgreens, if you go to CVS, pharmaceuticals are a commodity. It's not like, going and finding the best, back surgeon and it's going to be a different cost and you're going to be willing to pay for that cost. If you go to a pharmacy and get a drug and Cigna is the pharmacy benefits manager, or Blue Cross is the pharmacy benefits manager, or CVS Caremark is, or Express Scripts is, it's the same interaction for the member. And our job is to wring out all of the savings that we can where these entities, these intermediaries, are stealing. And they're stealing in rebates, and they're stealing in things like spread pricing, and they're stealing in contractual nuances where things like single source generics are treated as name brand drugs, but they're really generics. And all this non-transparency that we live in. I think there's money to be had there, probably in the neighborhood of, I would say, 10 to 15% of the drug spend.
Okay.
There.
What about the fund, reserve fund percentage? Is that the town's in that 10 to 15 range? Is that?
Yeah, look, we run our program like a corporate program. Because look, we handle a lot of self-insured plans. We run, at the end of the day, our job is to predict the costs that we think, from a budgeting perspective are realistic. Our job is to advise you on what should be in the reserve, and I use the word reserve for the incurred but not reported amount, the claims that are out there that haven't been paid. And we work with your auditors on that, and they review what we do. And that right now is about $350,000, I believe. And then at the end of the day, there should be some fluctuation in there for adverse claims. Like I said, it's not an exact science. So the percentage that we're using at the end of the day, I think it's about 15 to 20%, maybe, I think almost 20% of the.
Our number, well, what I have on the page here is less in the budget deck. On page 40, it's okay. It's just.
Yeah, it's like 950 on
call it
7-1.
Call it 10 to 20. I mean, I get it.
Yeah,
10 to 20.
that's it.
Okay, all right. Any other questions for Larry? Larry, can you go off this, just your sharing for a second so we can see the gallery and if there are any hands up or questions? Yeah.
I have a question.
Yeah,
I
Victor.
noticed that the library group insurance was $535,000 in fiscal year 2021. And so far, year to date, we've spent $0, and it's going up to $800,000 in 22. And I was just wondering, what's the explanation behind that?
So the library we brought back in a few years ago. They were in our plan, then we took them out, then we brought them back in. What you're seeing there in this year's projection is a number that we feel is indicative of their actual costs. Versus in prior years, it's been more around an estimated cost using our accrual rates. The costs there. So this year we were asked really to break it out more on an actual usage basis than an estimated basis, where we estimated their costs coming in off of their community rated program they had a few years ago. So, and another way of putting it, their numbers historically were combined in the total, and this year we're really trying to break out their actual costs versus the rest of the group's actual cost.
So in past years, your estimates, you've been underestimating how much has been spent by them?
Well, we really haven't been. In actuality, their spend has been above the estimate, but we didn't estimate. Now we have their real actual costs. So when we brought them back in, we didn't have any experience on them from their fully insured plan because they're so small, that we just applied our accrual rates to their head counts. And that produced, whatever the number was, between $500,000 and $600,000. But when you look at their actual usage, it's closer to $800,000. But we accounted for their usage in the total cost of the program. Now we're just bifurcating it out, and there is going up and the rest would be going down, but together we're still about flat.
Other questions for Larry on the health? I have one more, sorry. Do you forecast every 6 months or every year? Or how do you do your actual, do you do a mid-year check?
Well, no, we forecast. So we provide the initial forecast and then we refine it as you get closer to finalizing your budget. And we really haven't had to do anything else mid-year because we've run pretty much right on the budget. But
Yeah, okay.
Your point is well taken. I have groups that may be running a huge surplus, and I have a client that was running a huge surplus this year, and they gave the employees a contribution holiday in December. And then we have groups that are running hotter,
Yeah.
and we need to go to them and say, mid-year, you're running hotter, and we need to have a finance conversation to set aside some more funds to allocate. So,
Larry, I'm just going to jump in. I think that's a good point. As we go into Todd negotiations, we do meet with Larry and his team to look at and be able to forecast where each of these groups are. So we will be doing that come, I would say, March or April.
Okay.
Larry, when you refer to other clients, you're talking about private companies as opposed to municipal governments.
yeah.
I mean, private companies are more inclined to be more real time in terms of looking at their exposure and not adding to their current year, because they're looking at somewhat managing their P&L, whereas we are always looking ahead to a future budget year.
That's correct. But in our monthly reporting, and again, we haven't had to do this ever with you guys, is if we were running hot, if we got to January and we're running really hot, we would say, just because obviously you're talking and we would have these updates, we would say, we're going to run over we may run over our projection this year.
Okay, other questions? All right, Linda, I think we can move on. Larry, thank you.
Great to see everybody. Take care.
Thank you, Larry.
Thanks, Larry.
Thanks, Larry.
So I'm just going to walk through general government, and I'll begin on page 3, where we have some general government revenues, and then I'll get into general government expenditure lines by the department. I do see that there's some departments that are on the call, and so I'll call them out if you have any specific questions for them. So beginning on page 3, under finance, basically all of the state revenues that we get through the state, interest earnings, we capture those under the finance department. We don't necessarily generate that revenue. The governor did issue his FY22 budget this week, yesterday actually. And so some of these numbers, minor tweaks, we are going to update the ECS amount. I think I'm about $3,000 high on that. He kind of adjusted that. And then I would also want to take a look at, you'll see that we have 1.1 million in interest income, which is somewhat in line with historical, but as you know, we're going out with the RFP for investment services. And so I think we're going to take another look at that number and refine that number before you approve the budget in a couple of weeks. But all the other revenues have stayed fairly consistent under finance. The next group, we group them under the tax assessor. Here, there is a change. You'll see that there's 101 state property rebate. This is part of the pilot program. In the numbers we've seen from the governor's office, they've zeroed that out. I've been following up today with SEBI, and I also emailed Tom O'Day to kind of follow up and see why we got 101 and why it zeroed out. So we're still not sure why. But in the governor's budget, that 101,000 that we've historically received is phased out for New Canaan. And therefore, I'm trying to get to the bottom of it, but it may remain, or we may have to zero that as well once we get a resolution as to what's driving that revenue. Tax collections, again, those are based on the mill rate, the grant list, and how much we put in to be raised, to be used from fund balance. So the math works that number in there. Right now, we were estimating 6.8 million fund balance drawdown. Given the current grant list and the current budget, it generates that revenue amount. And so that number is probably going to change as we go through the budget and we continue those additional discussions. The next section there is the town clerk. The town clerk, for the most part, these are just fees for services that they charge. The big revenue there is conveyance fees. We are continuing to see increased revenues in conveyance fees year to date. This was about a month ago. We were at 1.3 million. I believe now we're almost to $1.5 million on $1 million budget. It's difficult to say what will continue with these with this conveyance fee revenue going into FY22. For now, we've kept it relatively flat to where we are. So we have 1.1 million in there, and I'm on page 4 right now. We feel that is probably in line with where we'll be, but we'll continue to watch this as we get closer to budget adoption if we need to tweak that number at all. But it's slightly lower than where we are this year, but slightly higher than where we've been in prior years. Land use, I did see Brian on the line. The big driver here is building permits. Based on my discussion with Brian, we've kept this flat at 830,000, which is what we have in the current fiscal year. Year to date, this was back in January when I ran the numbers, we were right at a little over 300,000. Brian, I don't know if you wanted to say any more on building permits.
Building permit fees are a roller coaster right now. We fell off a cliff last spring with the pandemic when it hit, but then about early July, we ramped up, the pendulum swung. We've seen unprecedented numbers of permits coming in. Many of them are smaller permits, though, that don't generate an especially big fee. There's still a little bit of a drain on services, but they don't really command a very large fee. I would not have a clue what to predict in these times for next year. Ordinarily, I have a pretty fair guess of my fingers on the pulse of the construction community, but this year I would just say leave it flat and we'll hope for the best.
Gary, what put your crystal ball on for this year, just to take my budget hat off and my 2021 current year, how are we going to end here? Are we going to hit the 830?
We are still very busy. The weather really hasn't slowed people that much, so I think we will.
Okay.
Typically speaking, in a winter like this, we slow down and get a big rush in the spring. I still see a spring rush coming because we're taking in demo permits. All of the demolition permits that we take in now, when they grow up, they're going to be building permits.
Okay.
In the very near future.
Okay. Excellent.
The next chunk there is parking, and we've had discussions about parking revenue. You know, we suspended fees because of the COVID. We've begun to slowly reintroduce some of these fees, parking meters and whatnot. We don't know where we will be in FY22. The current assumptions assume that by fiscal year 22, we may be back to normal. We had this discussion with the Board of Selectmen. It's difficult to predict, even with the seasonal permits, people may not be commuting as much to the city, but I don't know if that's going to impact whether they buy a permit or not. And this may be something that we also take another look at and maybe reforecast if we feel that we need to kind of adjust down. I think this is slightly aggressive in terms of the numbers that are in here. It assumes that we're going to be back to 100% where we were. And, you know, that's something that we'll need to, again, take a look at moving forward.
Yeah.
And then for the other revenues, these are department specific when we start talking about, you know, police and fire and public works. So I'm not going to go into those, but those were the general government revenues for this evening.
You skipped the COVID, nothing for COVID state reimbursements? You're not.
Oh, Right, because we don't know what's going to be in place for FY22. So I don't have any numbers
Yeah, it's okay.
plugged in for COVID. I just have what we've gotten year to date, but I don't know what federal programs are going to be available for that.
Yeah, look, 0 is probably appropriate for budgeting.
Right.
It's a surprise. Any questions up to now, at least on the revenue side? Okay, keep going.
All right, so page 7 is where we begin the general government expenditures. The first one is the first selectman's office. We just have, salaries is the biggest driver there. The first selectman's office doesn't spend much on anything else. You will see a line for dues and subscriptions. These are not the first selectmen's dues and subscriptions, but these are just town-wide subscriptions for things like CCM and organization that we belong to that are paid out of the first selectmen's budget. There are some salary savings with turnover between Tom and Tucker, so that accounts for some of the decrease in the full-time salaries in that department. The next one, and please stop me if you have any specific questions.
Linda, I'd like to point out
Sure.
the $30,000 economic development budget. Tucker is heading the TDEC committee, and Tucker, do you want to review that quickly? What we're trying to accomplish with that budget?
Sure. This is our second year with the Tourism and Economic Development Advisory Committee is in place. Last year, we funded several initiatives such as the October for Design. We had a outdoor land trust project, as well as the Live New Canaan project, which has been extremely successful in terms of marketing the town and especially into the New York area and that kind of thing. So we are now in our second year, and we have some working groups formed where we're exploring new initiatives as well. But again, our biggest job is to recruit businesses and really just promote the town to anybody that's thinking of moving here or opening up a business.
We also gave a grant to Channel 79.
Oh, we did, Channel 79, yes.
But the focus of that really should be downtown and supporting the realtors. We don't want to become a cultural grant fund. So.
Okay.
Under finance, this is where we have obviously salaries personnel is the biggest chunk of that budget, including Social Security and 401A contributions. The audit committee asked us to leave in here. We have two types of audits. We have the regular annual audit that we pay out of this account, but then we also have funding in here for an internal audit function or special audit services. Last year, we actually had a contract with Acume. We no longer have that Acume contract in place, but the audit committee felt that we should leave the funding there should a decision be made to move with another firm or to pay for ad hoc audits, because we also do those throughout the year that are separate over and above our annual audit function.
Linda, sorry, can you refresh my memory? Why did the audit jump 50%, 48?
So what that does, it's looking at the.
Go back to 2020 in the audit service, professional service audit. 2019 it was 66,000. 2020 was 64. 21 was 92, and we're up to 92 again. Why up 50% that year? What happened?
I believe that was just at the time when we approved the FY21 budget. We kept it at 92.5. The assumption was we would be bringing in a position, an internal audit position. And at the time, we were thinking that would be the range in which that position would pay. And we never moved forward with the hiring of that position. And we just continued paying. I believe we finished paying off Acume that year. But then we also had a part-time employee that was doing other functions within finance department, working with the fee studies and with the sewer fund, and therefore we use those funds to transfer out of that fund and pay for those pay for those services. But that's my recollection of it jumping from the 64 to the 92.5 and it being left at the 92.5.
So
Actually,
Linda,
no, let me back up. Nope, that's a different one. Professional services audit, that is our actual audit
That's what I
audit
thought.
service. I'm
Yeah,
sorry.
that's what I thought.
I was
It's okay.
confusing that with the line below it. That is our actual audit service. That was the year we had the regular audit, but then we also asked them to come in and do some additional work with auditing of, I believe we asked them to do, there was a human services audit. And then they also did an audit of cash systems with parking. And I think it wasn't charged to this account, but they also audited cafeteria accounts around that.
Why would it stay up there? If those were special purpose for service audits, why do we need to budget it at the same level again this year? It's a lot of money for audits. I mean, you got 92 here, 50.
Right.
That's going to begin to be a big ticket. I mean,
sure. We could review it. We could knock it down. I could talk to Joe and the audit committee and see what their thought is in that and what number they'd be comfortable with, and we could bring that number down.
I think you got to
because the on the next line, the special audits. I mean, you have 158,000 budgeted, but you've never spent anywhere near there. So why would you budget it so high?
Yeah, take a look at that.
I mean, it seems to me these two lines are probably about, I don't know, about 75, 80,000 too high.
Yeah.
I'm gonna come back to us on that one. The 92 to repeat seems kind of weird. I understand if we had 1 year where we add some specials, got it, but that shouldn't become the base for the next year. And then the 158, I don't know, looks like a lot of money. Just double check. Something. I think Chris is right. I mean, there's got to be $50,000 there. I mean, let's take a look at that.
Will do.
Okay.
The next one is tax assessor. Unless there are any other questions.
Yeah, I'm sorry, I'm jumping in here, but can you just remind me about our philosophy of internal audit? I know that's a big question, but I mean, are we saying
our philosophy?
That's a loaded question, Neil.
No, I'm just wondering.
Good question.
Listen, everybody, it's funny boy. I'm just wondering though, you know, in terms of, well, in terms of like, you know, how many audits, internal audits we have, are they internal, external? Do we try to do them internally? Is the goal 3 or 4? You know, I know we're not like a corporation with a big internal audit department, but just what are you trying to achieve in this? Is it only special audit on request? Is it something you identify?
No, this is actually driven by the audit committee. The external audit is required by law.
Right.
By state statute that we do at least one annual external audit. But the internal audits, I believe this was something that was started when the audit committee was created. And at the time when we had Acume as the firm that was doing the internal audit, right. I believe they had a goal of, I believe it was four audits per year. And then the audit committee would kind of, in consultation with the external auditor, determine which areas to audit.
Right.
Now, ever since Acume left, I don't believe, obviously we don't have another firm that's doing the audit, but I don't believe that the audit committee, last time this issue came up back in December when they met, and they said that they will be revisiting it first quarter of this year to see what they do, whether they go back and get another firm or if we hire an individual to perform the internal audit function.
Okay, so we're waiting for the audit committee initiative to decide what areas and how many in volume and what we need to do.
Yes, and I'll bring it up. We have a meeting, they have a meeting coming up, and I'll pass on that this was something that was raised at the Board of Finance meeting.
Yeah, if we could just ask them in conjunction with you to give us a perspective on what is the external audit, what's the internal audit footprint do they expect for the coming fiscal year? Because right now we just have $158,000 and we don't have a plan.
Right.
Okay.
And that would be a bad line item for us to just say okay on.
In the
Sure.
year in 2019, it was 127, and in 2018, it was 114. So it's growing quickly. Just get back to us. You got it.
Will do.
If I can just add to that too, I mean, I understand audit and looking at stuff, but there has to be some sort of, balance in terms of, it's use of time for everybody as well to go through all these audits. So kind of what is clearly trying to get accomplished, and then thinking about how much it costs, not just people time, but cost. I think that's important for the audit committee to think about it. It's just, you just can't say, I want to audit everything and I need money for it. It has to be, I think it has to be strategic.
And I think there should be some input from the Board of Finance.
Look, we want to be squeaky clean. That's our guideline number 1, 2, 3, 4, and 5, right? Squeaky, squeaky, squeaky clean. And we've been getting awards and have good controls. So we know we're in a good place. So we got to do what's appropriate. We can't determine what that is, but I think you're getting some pushback there on this. This is starting to creep up. And without a plan, it doesn't feel like it's in control. So let's just get the feedback, come back to us.
Will do.
Okay, thanks.
You're welcome. Tax assessor, primarily driven by salaries. There aren't, I'm looking at most of their other lines have stayed either flat. So they're coming in at 3.9%. The same with the tax collector. Tax collector year over year is actually going down 0.8%. One of their drivers is they do have some reductions in part-time salaries in FY22, just based on estimates. We did move tax cash collections from town hall to Bankwell, and therefore they do have part-time help that comes in during high seasons for taxes, and so they're cutting back on some of those hours for that particular function. So it's a relatively small budget, so small changes generate bigger percentage increases, but they're essentially coming in flat year over year. We've kept the legal flat at 300,000, and the way the legal budget works, there's two components. There's a retainer amount with the attorneys, and then there's also an hourly base amount based on the work that we ask them to do. But in total, it comes out to about 300. Last year, we were actually slightly low to 224. Again, last year was a COVID year. We were out of the office for some time, but if you look the year before, it was in that $300,000 range. And so this one we're keeping flat again this year. We are going into negotiations this year for collective bargaining, and I believe we have 3 unions that are coming in. That usually drives up legal services because we need their help as in part of that process. We do have contingency funds budgeted this year, and so we, in consultation with Cheryl, she feels that the 300 that's budgeted here is sufficient. If we should need any more, we do have contingency funds that could make up for that difference, and therefore that's why we've kept that at 300.
Linda, could you remind me what contracts are coming up? Which 3?
I will jump in there, Lunda.
Thank you, Cheryl.
It's police, fire, and public works.
Thank you.
And next is HR. So you are right on cue, Cheryl.
Well, my budget is pretty flat at 1%. I think the driving factor in that we see kind of go up and down is the outside payroll. We do have a contract with ADP. This year, we are going to see it go over because of the election and with the register of voters and Claudia's staff, it brought us over our numbers, but we are staying right around 1%. So unless you have any questions, that's a pretty flat budget.
Next one in general government is IT. IT again is largely personnel. The only change this year with personnel, and Cheryl, you can chime in, we did a reclassification of one of the IT staff persons. And I think they got like a $5,000 or $6,000 bump based on their revised job descriptions. But other than that, they've kept everything fairly flat. And so IT is coming in at 1.7%. For the size of the department and the work that they do, we get a really amazing return. on RT. Cheryl, I'll let you speak to the salary adjustments if you wish.
We had one of the positions, there was a change in the job description and the duties that he was doing. So we went out and did a salary survey, and we felt that that position was low. So we are putting an increase into one of those positions.
Town clerk is, again, biggest driver is personnel. Their total budget is going up 6.5% year over year. And their the driver for that is outside contract services, which is going from 15,000 to 46,000. And that is related to some services related to redaction for going online and redacting some information in the online documentation.
Here's another one. This was 382, 400, 467. What are we getting for almost another $100,000 from a couple of years ago? Do we have 3 elections a year now instead of 1? I mean, what is going on with that? That something doesn't seem right here either. Sorry.
I believe Claudia is on.
Yes.
So Claudia, as an example, advertising. I don't even know why that wouldn't be 0, but what is advertising of $10,000 in this day and age? I don't know if she's on or not, but look, that's a huge jump at 6%. Plus, again, it was almost 100,000 more than it was a couple of years ago. I mean, our IT budget was almost the exact same amount, and it's still the same amount 2 years ago. What's human resources? Human resources, 2018 was 384. Now it's 398. 14 grand in 4 years. But somehow this goes up almost $80,000.
Can you hear me?
Yes, now
Hello,
we
can you hear me?
Yeah.
Oh, good. Sorry, I was having problems here. You were asking about advertising. Advertising is for the town council. It's for all the legal notices that they have. It's for your legal notice for the budget. And we have no way of knowing how many notices we're going to have. So we usually put in about 10,000.
Okay, but Claudia, you're up $80,000 in 3 years.
Mm-hmm.
I don't think anybody's up $80,000 in that many period.
You forget. You're forgetting about a general election.
No. Don't give me that. Every year there's an election.
No, yeah.
2018 there's an election. 2019 there's an election. 2020 there was an election. 2021 there's an election. 2022 there's an election.
But we never had to pay for absentee ballots for all of our registered voters before. And we had 2. Don't forget, this year we had 2 primaries and 1 election, which everyone got an absentee ballot for.
I'm talking about this budget.
But that was this year. How about
I'm not talking about the current budget at of 439 for 21. I mean, up from 382. I understand, but now from 2021, the proposal is 467. So
that's okay. It will go down again. In the outside contract service, the $31,000 will just go off. It will be erased next year. It's a one-time thing. So it will go back to 14,000, for example.
Okay, but I'm just looking at the 21 revised is 439,000. And the budget that's being proposed is 467, and I'll call an off-year election. We have a local municipality, but there's no absentee ballot for statewide elections and that sort of thing in this November. So I don't get how that can go up that much.
Take $31,000 off the 467. And that brings.
So what is that? So Claudia, what's all that about?
Okay, so what that's about is a redaction project. Our land records index has been online for a long time, but we did not put the actual documents up because we had committed to the public a long time ago that we would not put that information out there: mortgages, deeds, liens, tax liens, etc. And because of COVID, things changed and we realized we really needed to probably put these documents online. But the only responsible way to do that is to have a redaction process or program that will go through and take out Social Security numbers and identifying numbers. And so the project is for 1980 through 2005, when we believe that there are Social Security numbers. We know there's Social Security numbers on there. And it's about, over 610,000 pages. And it's a one-time thing. So once it's done, it's done. And what it will do is redact what's going online. It won't actually change the actual document, but at least what people are seeing online, that won't be there.
Well, why would we, okay, so is that information available if I go into town hall?
Yes, it is, but you can't sit in another country or sit someplace in the middle of the night and collect this information. It's very easy to go on and get someone's signature from their mortgage. Then you can get their Social Security number. If I told you the names of people I looked up to see if their Social Security numbers were out there, you would be very surprised. And there's probably some people in the room right now.
So why do we have to put that online?
Are all the towns doing that? I'm sorry, Bob, go ahead.
I was wondering why do we have to put that online? I mean,
Yeah.
We don't. You're absolutely right. We don't. I'm not a great fan of it because I'm more of a privacy. I think it's more important to protect privacy. However,
looking at our
it
tax
will give greater access to the public for getting information, and it will reduce the number of people coming into town clerk's office to collect that information. And that's the only reason. Those are the only two reasons.
What's our liability of giving this contractor all of that private information? And what's our liability if it's accessible when they're done?
We do not have the town does not have liability. That is true. We don't. However, in my survey of the 169 towns here in Connecticut, there have been many cases where town clerks have put the stuff online only to have to take it down later on because of backlash.
I don't know. Well, I won't speak for the board. I'm sorry. It seems to me this is a little half-baked, and I don't know that if redacting and having online, I'm not sure what it really solves for. If you believe they'll be pretty much everybody vaccinated by June, why would we do this? And I don't know if you want to be putting stuff out to make it easier for the office. Online feels very risky to the town employee, to the town residents. What do others think? I could be wrong here.
Yeah, maybe if this is such an important thing, it should be dealt with as a separate request with a completely separate funding request, and just make the presentation to us and argue it. And we can decide if it makes any sense or not.
I agree.
No, but Chris, the point is that, it takes 5 or 6 months to do the work. And what Todd was pointing out, by the time it's done, we're going to be out of COVID.
Yeah.
So maybe we don't even need it.
Will be, but I just don't. I think, well, for us to vote on approving this, I don't want the responsibility of saying we paid for having all this information we put online. I don't know enough about it to even say I can approve that. I'd like to learn a lot more about what we're actually putting online and why.
And is that, so there's 31,000 of cost in redaction in that 46,855 number? Is that the math?
Yeah.
Yes.
Right, Claudia?
I'm sorry, could you repeat that?
No, I'm just trying to, the $31,000 you referenced that will ultimately go away, that's in the OS contract service line, is that?
That is correct, and it will go away, correct. It's a one-time thing. We get a lot of requests for documents where we are truly, more towns are online now because of COVID than before. The city of Danbury did a $130,000 redaction project before they put their records online. I'm getting push from both sides. I have people, users who want this stuff online. They want the access to it. They want to make it easier. There are attorneys that have to travel from Hartford, or they have to get somebody else to come down here to get records. And by the same token, on the other side, I'm getting a lot of pushback from people who don't want their records online. And
Well,
so
it's,
I'm kind of in the
The Hartford
it sounds
lawyer
to
doesn't
me,
live in New Canaan. We don't represent the lawyer in Hartford who has to drive to New Canaan. We
yeah,
represent the people.
it sounds to me like our local citizens are on the side that says, let's keep it private.
Yeah.
And the outsiders say, oh, they'll give us access to
Oh,
all
wow.
your data.
Yeah.
Wait,
Oh,
So I
wow.
would vote it. I think we should line this out.
Hold on, can I ask a question? I'm not sure for a decision like this, where the, what the proper area for decision-making is. I mean, there may be pluses and minuses on both sides of it. And as Claudia was saying, she's getting it from both sides. So I'm not saying necessarily it's right or it's wrong, but it seems like we just need to dig into it a little bit more to see what the best practices and best processes. So Chris, what you were saying, maybe take, I don't know, maybe take it offline, look at it separately, and then present it to whoever the proper people are to make the argument one way or the other, right?
Well, whose initiative was it? Somebody initiative here to do this, right? I mean,
well, it was mine, and I believe our administration, our first selectman, is in favor of it. I don't want to speak for you, Kevin, but I think you had expressed to me that you would like to see it online. I did reach out to the Board of Realtors, and for the most part, they had wanted it online. Not heard back from them. We don't have to do this. I mean, there are pros and cons to both sides of it. I did a lot of research. I'm happy to share that with you.
But you didn't seem so excited. You didn't seem excited about it yourself.
Yeah, yeah. Let me speak for myself. Back in early January, we had town clerk office employees complaining that they didn't feel safe. Other towns have done it because they closed their town clerk's offices. Norwalk is still closed, right? And I think of the 79 clients of the vendor we use, we're the only town that has not made their records available online. That tells you something, but it also, a lot of them have not redacted. So Darien has not redacted, and they have their records online. So it is a decision. I was responding to the fact that our town hall employees didn't feel safe. So.
Well, I think, Kevin, they didn't feel safe. That what they were expressing is they didn't feel safe with the entire town hall coming back at the same time. I think that's what was.
That's not true. We were going to cohorts back then, Claudia.
Yeah, Claudia, I think
No,
it was,
no.
we went full time.
Okay, I guess this is where, let me just make a suggestion to the Board of Finance. I don't feel comfortable approving this because I don't know enough about it, and I think we ought to hear more. And we're not voting on anything tonight, Claudia, but I would just suggest this. If we want to have a special $30,000 appropriation to do this, I might want to handle it that way and not rush the decision. I feel like we're rushing a decision. And if we have, kind of breakthrough, which we expect over the next 90, 120 days, I guess I'd question how important was this to get done. And there is risk of putting people's information online. I'm sorry. And redacted or otherwise, I just don't know that we want to be party to that. Again, I don't feel comfortable making that decision without more facts. How's the board? Would you be okay just kind of holding this off, maybe taking this line item out for now, and when we vote on our budget in May, if we need to deal with it or talk to the town council, we will.
I would agree with that. I think Chris is right. Let's take it off of the budget and treat it as a one-off if we have to. And I would really be interested, is there any guidance from the state as to what best practices would be? Or are there?
No.
I mean, sorry. You don't have to answer that now, Claudia, but I think in terms of if we make this a special presentation to the board at some point, that would be something I would be interested in knowing.
So I guess that the town clerk, being an independent office, can be the initiator of this request, and then it would come to us, town Board of Finance, to fund it. So maybe that's so to just go back, George, what you said and what Todd said. Let's take it out. Let's study it. And then if we need to do something on a one-off, then let's do it that way.
I don't want to beat this to death, but just a quick question. Are the newer documents online that don't have the social security? You mentioned 1980 to 2005.
That's a good point. Most of the records that have that information on them go back into the 80s and 90s before lawyers became sensitive to privacy. They know it for the past 15, 20, 30 years, they haven't put that information on record.
So can we nuance it and put the new stuff on and then?
No, you can't, because in order to do a proper title search, you have to go back 40 years.
Got it.
Yeah.
Well, that's, hold on. Yes, you could put I was expecting to do that anyway. Put 2005 to current up. That's correct. You can. And that would help some people anyway.
I guess
you're right.
somebody-
The titles,
I guess you
but
could
not
opt in
everybody.
if you wanted. Let's not try to solve it here tonight. We'll table it. I think you got the feedback. Kevin, you're all right with it? I don't know how many.
No, we left it in the budget, figuring I may not. The Board of Selectmen has to approve the contract, so I didn't plan to spend it if we didn't need it back later in the spring.
Okay. If everybody's okay, that's how we'll proceed. Let's just table it for now. Take it out of the budget. Let's get some more facts and data, and understand what we're really committing to in terms of town data. Okay. Okay.
Thank you.
That is the big number. You're absolutely right. That is the driver of it. And okay, great.
Thank you.
Thank you.
This is the most exciting general government has ever been.
Only halfway done.
You are right, Lund.
I was getting ready for a boring session, but anyway.
Surprise.
Registrar of Voters is going down 6.4%. And again, the driver there is they did have an increase in revised budget because of the elections and all the activities related to the elections. And so in FY22, they've brought it back down to a more realistic and kind of normal year.
Despite the fact we gave them raises.
Exactly. That is despite the fact that their salaries were reviewed, and therefore you will see that a 9% increase year over year, the revised salary, but it was actually the approved salaries were 44,000 going to 52. I believe we went from 22,000 per registrar to 26,000 annualized per registrar. Land use, I see Brian and Tiger, and maybe you guys can speak to this 1% increase year over year. There were a couple of, and these were listed in Kevin's letter, some contractual services related to studies that are required by the state. And I'll toss it to you, Brian, Lynn, and Tiger.
Right, those increases, it's a 1% increase year over year. We have a $35,000 line item increase in our professional services. That's for 2 studies for Lynn. Lynn, if you'd like to fill the board in on what those 2 are for.
Sure, good evening. The first one, under state statutes 8-30J, in 2017, they added in a little requirement that if there's an affordable housing plan that's required by all 169 municipalities in the state of Connecticut, and it needs to be submitted by July of 2022. We've gone out and asked a couple of consultants and asked several area planners what the average cost would be to have such a report prepared, and you've come back with a rough cost of around $30,000 for that report. The second report that we're gearing up to prepare is currently the town of New Canaan has an active moratorium that's going to expire in June of 2021. And we've looked at the cost of how much it cost to prepare it back in 2017 and how much it will cost to prepare it again. And we've based on what we paid last time and talking to other area municipalities, it's about $20,000 to prepare that. And we're hoping to prepare that later this year once we get the actual census data released.
Hey, Lynn and Tiger, just maybe a dumb question, but if every town has to do that special affordable housing plan, some consulting firms going to Wilton and Ridgefield and Darien and Norwalk and selling the same $25,000 project to them. Could we get together with 3 or 4 surrounding towns and just say, hey, get one firm and let's do the whole thing for 50 or 70? I mean, do something to, well, I'm kind of, do everybody a favor and save a little bit of money, but maybe not.
So you're basically asking if they can do a regional plan as opposed to what the state is asking?
No, they need a town plan by town, but my point is they're going to do the same thing, right, in each town. Well, is there any synergies for doing the same plan in 4 surrounding towns is really the question.
That makes sense on the surface, but I think the problem with that is that the numbers that we run are specific to each town. And although, on the surface at a 10,000 foot view, we are similar to Ridgefield, these numbers are so specific, I don't think they can do that.
Yeah, I'm just saying it's the same model, right? Ridgefield, you take out their data, you drop in ours. It's maybe not worth the effort to brain damage.
We don't even know the model yet, by the way. The state hasn't even given us that yet.
Okay. All right. Okay.
Okay, I believe that concludes general government.
Awesome job. I mean, that's really great. IT, HR, to you 1% is unbelievable. That's just overall a really, really, really good job. I think I only have a handful of follow-ups. No one likes my multi-town idea, I can tell. So that's okay. I might feel.
I do.
No, it's great in theory.
You might like it, Lynn. I don't know. I just thought. Anyway.
It's great in theory, but the state didn't structure it in such a way that could be done. I don't think.
Yeah.
Do you notice we're one of the few governments that don't have a county government?
Yeah, thank goodness. That costs money.
An extra layer of government. That's what we need.
Government.
Let's not encourage them.
Not go there. Exactly. Good point, Chris. Okay. I don't know any questions. Judy, any questions for general government? It was really great.
Yeah, question, what does that mean, an affordable housing plan required? Required of what?
So,
expansion in affordable housing or numbers of people or just review of current buildings and expansion and what we're doing, what we have done at Millport and what we are doing? What does that entail?
So the plain text of the statute is that it's how the municipality intends to increase the number of affordable housing units. In 2011, New Canaan prepared a housing opportunity study. We actually have it online. And it actually looked at potentially how we could increase affordable housing. And we've actually done most of the action plan items. We've redone Millport, phase 1, phase 2. We're working on Canaan Parish right now. We've applied for a moratorium. We've obtained a moratorium, and now we're trying to keep it. So at the end of the day, in the past, our affordable housing plan has really been to document as a town what we've done and how we're moving towards what we're required to do. And the state has been, as Brian has said, not so much forthcoming in what they want. At the tail end of December of 2020, they issued a paper outlining how we should go about it. It was really a basic, it basically said, hey, you need to engage the community. You need to determine whether you want to have a task force or a consultant. I mean, it didn't really give you much information. So we're at the recommendation of and conversations with several other planners in the region, we're sort of waiting to see what the first communities in Connecticut do and how they take it forward. And if they're taken to task on it, what we should send out in an RFP to kind of get a gauge of what specifically the state's going to look for.
I think, Judy, what they're looking for very often is ratios with between mean household incomes and average house, single family dwelling home sale prices. Those are some of the ratios they look at with that.
So this is more than what we did 15 years ago, or it's just an expansion of that?
I think it's an expansion.
It's the same thing plus.
Right. The one that we did way back
But
in
we
the day,
met. Did we not meet our obligations? We did.
No.
No,
We were, to get
we
to the
came-
moratorium, we did.
we came within, I think it was 10% in order to meet the moratorium, but we didn't actually meet our obligation from the one that we did way back in the day with Steve Kleppen, back in.
Yeah, right.
So just to clarify, so there's two different things going on there. So this part of the state statute was added in 2017. So it's different than what we did in 2011. So this is a new requirement that's being mandated on all 169 communities in the state. So, and everyone's required to submit it, actual plan by July of 2022. And it's going to be recurring once every 5 years. We're going to be required to update it and keep it and make sure we have it. The moratorium, we're not at 10% of the required number of affordable housing that we're required to get. What we calculated in 2017 to get our moratorium is our HUE points, our housing unit points. And each type of housing in town counts for a certain number of HUE points. And so like senior affordable housing at the schoolhouse apartments would count for a certain number of points. Millport, if you have a 2-bedroom unit versus a 3-bedroom unit, counts for a certain number of points. So you have to do a specific calculation of the number of units, when they were, how many of them we have, and each of our units, it's determined by a date. So like we go back as far as Avalon, which is in the 90s. Schoolhouse apartments were approved by the Planning and Zoning Commission in 1998, December of 98, if I recall correctly. And so it follows the 830G law that was in place back then. So there are different requirements. So we got HUE points at a greater number because the law required a different statistic and a different number than it does now. And now we have to come up to where we're what the state wants.
We're also losing some of the Avalon numbers also, aren't we, Lynn?
The Avalon the deed will end, yes, but we can't recount them anyway. So everything that we counted for the first moratorium can't be recounted. It has to be new housing units that get counted. So in the last moratorium, we've used of the Millport, we only used 2 units. We have all the balance of the Millport units to count in the next moratorium, as well as all the Canaan Parish. And that would get us to moratorium 2 and potentially partway to moratorium 3.
They need the C of O though for Canaan Parish to count those units, correct?
They do need a C of O. They need to have, the deed needs to be recorded. The recording, there are multiple things that they need, yes.
That was always the plan. Has there been a new law written, or is there legislation currently under review to change all this?
So they've modified 830G over the years. I believe it originally was enacted in 89 or 90, and they've made modifications many times since and amended it. There is currently a bunch of pending legislation up at the Assembly, at the Capitol, for multiple different types of legislation related to affordable housing.
They gave us, at least the last time, and hopefully, Kevin would be noticed on this. They remanded all the first selectmen to a meeting, and they literally told us no uncertain terms what we had to do over what period of time. Everybody was a wreck, and I think we all went back and did whatever we could to get it started. Wouldn't they at least put us on alert if this was all going to be new, changed, and amended again, revised again, new legislation?
For 830G or affordable?
No, for your requirements to meet the criteria. I remember I called Scott Hobbs the next day and asked him to do this huge job that he's done for years. But
it was very transparent back in the day.
Yes, it was very defined. I mean, there was.
It was not a sucker punch. We saw.
No, it wasn't. We knew what was coming and we did it. That's right. So why is this so lacking in transparency? It just feels that way.
Okay, but
anyway,
I don't know if we know the answer, but
I don't either. But
we'll keep working on it. Lynn, thank you very much. Okay,
Sure.
Thank you.
There was one more that I did, and Cheryl reminded me in general government. The pension and OPEB is going down 1.8%. And I think Diane is here to speak to that. And then our insurance liability, we typically put in a plug of 3.5% this time of year. We don't get the renewal notice until April or May. And once we get the renewal notice, we plug in the actual numbers. It's usually relatively close to that. So that numbers will change before we get to budget adoption. But I will invite Diane to talk about the pension and OPEB for FY22.
Okay.
Sure. Well, if you all recall from the January Board of Finance meeting when we had Ellen from Hooker and Holcomb, and she gave the whole report on the actuarial valuations, which the Board of Finance approved. These are essentially the numbers that were in her report for what the town is going to contribute to the pension. And then the dollar amount of the $279,981 is what she was recommending that the town put into the trust fund, which is one component of the ADAC for OPEB. So I think she went over it pretty well, but if you have any questions about those numbers, I'm happy to answer anything.
Questions? I think we got a good overview before. I think we're good, Diane.
Good. Okay. Thanks.
Okay, thanks. Thanks, Linda. Linda, anything else? I think we got it.
I think we're done. I know Lisa's been patiently waiting.
Yeah, exactly. Sorry, Lisa. Great. Okay, over to the library. Thanks, guys. Neil and Chris, did you guys want to just say anything? I know you've been working on this with them and everything. Did you want to, as the liaisons, open it up with any comments, or are we good to right to Lisa?
I'm happy to start, Chris. You could go over after. We started attending these building committee meetings, and we missed maybe one or two, but we caught up in reading minutes, and we've been watching the whole thing, the process go. And I think I don't want to take Lisa's thunder because it's her show, but we're very happy with the communication and the give and take back and forth and soliciting discussion in different, strategies. So we feel included. I feel included. Chris, I hope you feel included. And then Lisa does the master presentation, of course.
Yeah, we're Neil and I are on the building committee, as we said, and I've been quite impressed by the level of work that they've done, the depth of knowledge that they have on the building committee. They're really going through everything in a very meticulous manner, and they're certainly trying to build a first-rate building at an affordable price. So we're still waiting for the final numbers. We think those will be coming in a couple of months, but they're heading in the right direction with respect to the building. With respect to the annual budget, we had a meeting with them, liaisons. Budget seems in line. Lisa will talk to it, but I have no specific issues with the budget that they're going to present.
Okay, you ready for me?
Over to you, Lisa.
What is diplomatic? No introduction.
All right. So, Linda, may I share my screen?
Yes, I believe Tucker has the power.
I think I already did, Lisa.
Terrific. Thank you. So before I get started, I wanted to take the opportunity. I think they're probably off the call now, but from the library's perspective, there've been a couple of silver linings in this year, and working with both Jen and Bethany have been two of those silver linings. And it was great to see them earlier tonight. And I'm glad you encouraged Jen to talk a bit about what she's been doing. Cheryl, who's on the call with me today, and who has managed an awful lot of our decision-making and planning around COVID, and I have spent a lot of time talking to Jen, conferring with her about each and different stages of our planning for reopening and different things that we're doing, and making sure that we're in line with not only state guidance, but also making sure that Jen is fully happy with everything we've done along the way, and that's been great. And all of our team has been working with Bethany on making sure that we're a part of this service to our community, especially the elderly community in town. So it's those have been things that wouldn't have happened in a year without COVID. So that's been great. So this year, I have decided to do quite a different sort of presentation for you. You know, I normally come with lots of graphs and figures, but this COVID year has been just so different that I thought I would tell the story of what our incredible library team have done this year before we go through the actual budget numbers. So just quickly, as you know, I mean, this is a sources chart. When I was putting this presentation together a month or so ago for the selectmen, it seemed important to just, you know, go back to making sure everybody knows what our sources of our income looks like in terms of proportions. And then uses. In this case, this uses one is based on last year's audited numbers. And you can see, you know, that one of the things we've been aiming for over the last few years is increasing proportionally what we're the resource we're putting to serving the families in our community. And so that's been growing steadily. And so that's a very good news story there. So, you know, COVID, has changed so much about the way we work. On March 10th, we knew it was coming like a tsunami, but we nevertheless went ahead with a live in-person event. We hired Woodway because the demand for this event was so huge. And the next day, of course, everything shut down. By March 16th, the team had shifted all of the programming to online programming and have subsequently done I think we've had over 14,000 people attend our online programming since then. By 17th of March, so a week after we closed, Cheryl and the digital services team completely revamped everything on our site to make all of our digital collections really easy for people to access. And we really ramped up the access that people had to our librarians, whether it was by telephone or Zoom or whatever, so that they could learn how to make the most of the ebooks, e-audiobooks, all of the research and IT services. As soon as we were able, June 15th, we started curbside self-service pickups. I think what's really important to mention about that is, you know, we have a team of part-time people primarily who do all of the check-in, check-out. To do curbside service meant incredibly inefficient processes around the quarantining and the other processes. Every book had to be handled 4 times to get it out to the door. So it was incredibly labor intensive compared to normal. But there was huge demand for all of this, and the community really, really was so happy to have it. And I've just been looking tonight at the numbers. Our community has carried on borrowing books. We're only down at 6% year on year of the number of books that people normally borrow, even though people aren't coming into the library and spending any time. That's pretty incredible, given that we lend books at one of the highest rates in the state. So this was our last event. We went from this 300 people in a room to the doors closed 24 hours later. This is a shot of our front lawn, which, you know, some people would have you believe is very unpleasant. It isn't. It's wonderfully pleasant. And this is the week that no one had any power. And our team turned up at 7 o'clock in the morning. They brought power cords and power strips from home. We brought all of the chairs and tables out onto the lawn so that people could access our Wi-Fi safely outside. And we did this for a week. We had upwards of 1,000 people a day logging onto our Wi-Fi so they could carry on working, studying. We got the loveliest note from a woman who was halfway through exams in her summer coursework when Isaiah came, and she was able to complete her exams out here on our lawn. we were setting up to reopen at the time of the hurricane. We ended up opening a few days earlier than planned because it was just so clear that there was so much demand, and we were ready. We were chomping at the bit to let people back in anyway. So we did that in August. At the end of the year, the calendar year, which I atypically asked all of our team to actually, all the managers to write a narrative reports with lots of data about what the year of COVID had meant, what had happened, and what metrics they could give us and observations. And one of the team started her report with this, and I thought it was so apropos of everything that happened for us in the library. And yeah, there was all sorts of stuff that was just dreadful, but the fact that she focused on the opportunities for insight, creativity, and collaboration really cheered me, because that was what made this year bearable. We collaborated with more nonprofits than I think we have ever before. The creativity that the team showed in trying to make sure that we continued to get services to people. We now have a housebound delivery service for people that are either temporarily or permanently unable to leave the house. We're delivering books to their door, into their hands. As I said, we participated with Bethany. That was after we had already, we didn't know early on what she was doing, but the team, we put together a list of 50 odd people in the early days, and our team were calling, writing, making sure that they were fine, making sure they were getting books, making sure they had access to everything they needed from the library. But that went on for months, and I only found out much later that a lot of our team were going out and doing the shopping and other sorts of work for the people that were on their list to call. This is sort of this is about borrowing, but so much follows a similar pattern. You see the drop off there in March into April with book borrowing, and people couldn't get into the library, but you see the spike of people that after all the years we've been buying ebooks and trying to get people to make use of them, suddenly they discovered that they were wonderful and they couldn't do without them. And that ebook borrowing is still much higher than it was before. So since that March 10th date, we've had 400 odd learning and cultural programs delivered virtually. This number's gone up to 14,000 people attended those virtual programs. We did lots and lots of technology training sessions because a certain cohort of our residents had never had to make use of all of these internet communications tools before. And it suddenly became the only way to communicate. I was in the library one day when a woman came in who was in her 90s, and her cousin was having her 95th birthday. And the only way she could congratulate or celebrate with her cousin was to learn how to use Zoom. And she needed to learn it that day so she could participate that afternoon. And things like that happened just every day in the library, where they came to us looking for help so that they could stay connected and stay, active and engaged. We piloted our first 6-week learning course. That's a big growth area for us in the future, more intensive learning courses. We had 85 book a librarian sessions for in-depth reference, research, and IT. And we, as I said, we started a homebound delivery service, something we'd been wanting to do for a while. And it grew out of this time of people not being able to leave home. As I said, the work and the collaboration with the community was another real bright spot this year. We supported 13 other nonprofits to continue to deliver on their mission by the provision of technical assistance. We supported more book groups than ever. We're at 25 when I was putting this together a couple of weeks ago. And we partnered with 25 other nonprofits to provide informational and cultural programs. And again, the community outreach that we started with our 50 elderly people, and then started working with Bethany and integrated with her program. So of course we had to carry on with all of our usual things, including fundraising. I've got to say, on March 10th, trying to imagine what a year of fundraising when we couldn't do our events would look like was scary. But we actually put on a lit lunch. It ended up being at night. It ended up being digital, and people paid a lot of money to have dinner at home and watch our author on their TV screen. And that was amazing. And they did it because they support this library, and it was truly overwhelming. We got incredible support. We had 1,419 people participate in that lit lunch. So a higher number than we've ever had before, even though, as I say, they had to eat their own dinner at home. So, we had to cancel several things in the spring. We didn't do any fundraising. It seemed completely inappropriate in the early days to be doing any fundraising when people were getting sick and dying. We did resume fundraising when it seemed like it was okay to do so, and ended up reaching our targets by year's end. All of our other revenues from fines, room bookings, et cetera, were down by half. This year they're at zero. We haven't been able to get any of those other revenue lines. But there were some real bright spots, and the community continues to support us at the levels that they have done in recent years, and that's just been incredibly gratifying. I really wanted, in doing this very different style of presentation for you, I just wanted to recognize our team. They are so unbelievably dedicated. Every single one of our employees worked throughout the lockdown. They were cheerful, they adapted quickly. There was no hesitation to pivot, and I know that's become the most overused word this year, but they really did. No matter what their job, if it was something that could easily be adapted to the new environment, that was easy. But so many of our people started taking on all sorts of new responsibilities to make sure that we were putting our all into serving however we could. They adapted to the full-on digital services. They built and supplied parts for face shields for a regional hospital. Our team supported older and isolated New Canaanites, undertook professional learning for those who didn't have enough on their plates. And we received scores of emails and cards and phone calls from all around the community expressing their gratitude. At the time of the lockdown, we had 12,000 books out in the community, and we couldn't get them back straight away. And when we could start taking them back, there were really, really cumbersome quarantine requirements in the early days. And we still have quarantine requirements, but they're not quite as cumbersome. And so getting them back in, there were huge bottlenecks, and people were very frustrated that they couldn't drop their books off whenever they wanted. 14,000 odd books went back out through that curbside pickup. And in that 2-month time, every one of those 14,000 books got handled 4 times because of the cumbersome coronavirus related procedures. Additionally, we added 2,500 new books based specifically on requests from individuals in town. And we undertook some very large IT system conversions and migrations to the cloud that had already been planned earlier over the last several years. So that's it. That was the end of my presentation, and we can go through the budget. But based on the conversation we had last week with the liaisons from Town Council and the Board of Finance, I wanted to just, I did include this, which is the preliminary energy modeling. I had a couple of questions from the liaisons about energy costs in the new building. Obviously, we're still working on that. We're working very hard at the moment to get everything ready for our application to planning and zoning. And I know this is not a meeting about the new building. It's this year's budget, but because it came up last week, I thought I would share with you. This is the modeling. You can see in the furthest left column in pink, our current costs of energy. That's for heating oil and electricity. And you can see the range of possible options that we're going to end up with. At the moment, we are looking at the 5th column from the left where it says $1.23. We'll be somewhere between that ASHRAE 2013 baseline and the envelope upgrades as our likely cost. So that's price per square foot per year on total energy costs. So just to confirm that our energy costs will be going down. So as for the budget, I don't know, it's so very straightforward. I can go through it, but you all.
Lisa, I would do this. We have the line item in the budget book. The question I guess I would have, people know it and have gone through it. Any questions for Lisa? First of all, great job.
Wow.
And congratulations. I'm always riveted when I hear and see those statistics. I think that is great backdrop for all of us to see what the library is used for and how things happen that you didn't even think of. I mean, you got 80 people in the yard doing email. I mean, unbelievable. Really a great job. Really great job.
Thank you very much. We have a tremendous team. I am so incredibly proud of the team that we have at the library they're truly, and I know this is true across the town, all the town employees, but they are just truly so dedicated to this community. And I don't think that it's terrible that it takes something as awful as something like a pandemic to really highlight it, but it just highlighted the level of devotion that the team have to the community they serve.
Yeah, no, it's unbelievable. Questions for Lisa on her budget. You see the proposal, what the Board of Selectmen approved, the 2.4. 2% increase. Wow. That's a first. That's a first, not a single question.
Looks good. It's good.
I mean, everyone has gone through it and the liaisons have kept us up to date, but that's great. Yeah. Says, I can't believe there's not a single question. I'm going to wait another 10 seconds just in case I see Victor's come off mute. It looks like he's loading. He's getting ready to ask one.
No, I wanted to say, I was familiar with the 6-week learning course, and it was the first time they did it, and it was on medieval Spain. And my wife was a facilitator for that, and it was fascinating. I didn't actually attend the course, but it was about how Muslims and Jews and Christians all got together in medieval Spain, and it was like a college level course.
Fantastic. Wow.
So yeah, well, actually, Victor, thank you for. I mean, I know everybody wants to go and get home and go to bed, but actually we're all home.
We're home.
leave the Zoom, but yeah, I mean we've seen demand in recent years for that sort of more in-depth learning for adults, and so the plan had been to do that in person. It was going to be a 6-week course. We would have had the 40-odd people come into the library and do the course, and when we shut down, Kayla, who worked with Victor's wife to do the course, said, I guess we should wait until fall or whenever we're going to open. And I said, why wait? Why wait? People have got more time on their hands now than ever. Let's try it out. And it was unbelievably successful, and it is a model for the future. We got a lot of really good feedback about the course, and it's clear the intellectual curiosity, and this is no surprise to any of you in this community, there's just such a thirst for good quality knowledge and learning at every stage of life. And so that is going to be a part of the future going forward. And of course, our new facility is going to be such an enabler for that sort of really good, high quality learning experience as well.
So the only question we would have would probably be, when are we going to have you back to give us the update on the building? Because it's not tonight's conversation, but it's coming, I'm sure. So
it's coming. So Chris and Neil, we'll talk about that actually tomorrow in the building committee meeting, I think, because I think we've got some forward momentum. One of the things that we talked about, Chris and Neil and the rest of the building committee and the delegates from the town council, we talked about 2 weeks ago, was making sure that we were moving as swiftly as we can on all fronts to go through all the various processes, because there is an expectation, and obviously nobody has a crystal ball, but there is a strong expectation coming from the building and construction world that there will be a post-COVID resurgence, and that if we can lock in pricing sooner rather than later, and if we can stick to our timelines and try to get this building underway this late spring, early summer, which has been what we're aiming for all along, then it would be great for the project, for the town, for all of us, if we can lock in prices before this potential surge in construction pricing on, you name it, steel, everything else. So I think we're all really cognizant that if we can do, make multiple things at once and run several things in parallel, that we should do. And I think we're all agreed about that. I think, Neil, you would say that's pretty, everybody feels comfortable about running some things in parallel and having some contingencies in some of the decision making, so that we can have the sequencing that people want in terms of being sure that they know enough to make decisions. We don't want anyone to feel that they haven't got all the information they need.
Yeah, I agree. And it's, we're dual tracking as much as we can. It's going to be hard to get the memo of understanding and the bond deal and, the loan, whatever, the grant, all synchronized, but we're trying to do that. So we'll do our best.
Okay, let's move on, but great job, Lisa. Thanks.
So good to see you all. Have a good night.
Thank you. Yep,
Okay.
great. Thank you.
Bye-bye.
Okay, all right, Steve, over to you. Save the best for last, recreation.
Hi, Todd. Thank you for having me here tonight. Tucker, we have a PowerPoint thing, and I think Ronna Siegel, our chairman, will be one to run it.
Okay. Yeah, we all got it in advance. We went through it, but yep. Okay.
Yeah, good. All right. All right, as you can see, the goals of the recreation department is to serve the needs of community, promoting long and healthy lifestyles through active recreation. And this past year has been a challenge, but I think we've been able to serve the community. A lot of people are looking for outdoor activities, which we've been able to do. Our budget is made up of 7 budget divisions: administration program, Waveney House, paddle tennis. We have facilities and buildings, which are all the facilities of different parks. Civic activities, which are programs and things like concerts and other activities. Willamette Community Center, which is the adult community center in town, which provides the needs for everyone from 40 to 90. And we also have Kiwanis Park. But overall, all our budget divisions, the whole budget is up by $14,305, or like 0.73% for the year. If we want to go by budget, each budget division, we can do that, and I can give you some highlights there.
You could just keep going, and no. I think you can walk through it, and if there are questions, people will jump in.
Okay. All right.
The only thing I will say to the board, I can't see all of you, please. So if you have a question, you're just going to have to jump in. If you're raising your hand, we can't see.
Okay. This next slide shows our revenue versus expenses from fiscal year 20. And you can see administration program, we had expenses of $1,040,000, and we brought in $620,000 revenues. We returned 60 cents on the dollar. Waveney House, again, expenses versus revenue, we bought back 85 cents on the dollar. Paddle tennis has been booming. It's been growing prior to COVID, and after COVID, it just grew. People were playing in the summer and they're playing in the fall, and paddle is just it's exploding. It's a great to see it. And as you can see, we bought back $1.56 on the dollar last fiscal year. Lapham Center, Aggie Lynn Bond and Aggie Aspinwall have been doing a great job there. Now we had to close the facility down to the public. They've been doing a lot of Zoom activities and programs, and working to the needs of the seniors and other adults in the community. And last year we brought back 37 cents on the dollar. So overall, our budget, we spent $1.761 million, and we bought in $903,000, and we returned 50 cents on the dollar to the town. So, which is pretty good. These next couple of slides, I set for your information. That just gives us our programs by season over the fiscal years. You can see what the revenue was for each individual program. You could just pop through those quick if you want. You can look at those. We sent you the programs. So you have that. Tennis is on a comeback. We were shut down through early May, mid-May, because of the COVID crisis by the state. People want to get outside and play tennis. Tennis is a sport where you can play and play singles, doubles, and play safely. USTA came with some rules about using masks. The high school tennis courts, we opened them up about the first week in May. We allowed residents to sign up on our tennis bookings a reservation system. And they were able to make a reservation for a 9, 10, 11, 12 o'clock afternoon courts evening. It worked very, very well. People showed up, knew they had a court they could play. As we opened the Mead Park courts the first week of June, we saw a resurgence in the number of permits sold to Mead Park. As you can see, we pretty much doubled our permits from 2019 to 2020. So tennis is really on an up and coming activity. Our clinics just exploded this summer. We had hired 2 gentlemen 2 years ago to start working with our fall clinics, and they took over our summer clinics, and our numbers just went through the roof, and actually last fall. So we had a great year with our clinics. I know we had 513 total participants last summer between adults and youth, and we had over 200 participants this past fall with our programs. So that's very strong. It's done well. Go to the next one, Ron, if you want. Paddle tennis, like I mentioned, this shows you a comparison from 2017 to 21 year to date. Our adult permits are up. Overall, our revenue is up. We did raise our guest fee from $5 to $10 back in 2019, but you can see that our year-to-date revenues are $70,000, which includes permit fees and guest fees, and that's just for that. We also brought in revenue from our clinics, and we've had over 230 participants in clinics in the fall and then again in the winter, and we had revenues about $53,000 from the clinics. That's not shown here, shown on recreation revenue, but paddle's strong. It's going well. There's interest in playing spring paddle, interest in playing summer paddle. There's interest in additional clinics for the spring, which we may have to look at trying to transfer some funds from our part-time salaries to our program account to cover that. But it's a great sport. It's growing. I know Tiger will be talking to you about the plan to convert the hard court at Mead Park to more pickleball courts, which is a big growing sport, and that'll be another activity we can have to offer to the members of the community.
Hey, Steve, this is Michael. As we talked about in our subcommittee, great job on the paddle tennis, and I think it's awesome that everyone's playing paddle tennis. And as we discussed in our subcommittee, I really think the great opportunity is to make paddle a year-round sport, as we discussed. And I really think that the huge opportunity for growing the game is encourage people to play during the spring, the summer, which people are doing, but also, give access to the hut, which we talked about. So as we discussed, I think one of the things I would like to let the Board of Finance members know is we suggested putting security cameras on the hut and a combination lock so that people can access the hut. And I don't think we really need to pay for another person to watch and monitor. If we have security cameras and a combination lock, so that only the people that are members of the New Canaan Paddle program can use the hut, I think that's a home run. I think, as we talked about, Steve, like a lot of people would love to use the hut, the bathrooms for just, when COVID is done, for relaxing, talking to friends, and having a place to sit down. And the combination lock will prevent people that are not New Canaan members from joining. And that'll be a lot less expensive than hiring people sitting there, during the summer when it's not as busy to do that. So I just want to tell the Board of Finance members, that's something I think, Steve, you and I talked about that you're going to look into, and hopefully we can get that done sooner rather than later.
Yeah, we'll look into it, and we'll see. There may be some things we have to look at at hours, restricted hours, or whatever, but we can look at doing that. That's something.
Is that in the, what's the cost for a lock and for a couple of cameras? I don't even know what's in the.
I don't have any idea. The locks would be about $6,000. They're about $2,600 a piece, and then I don't know what the security system would cost.
Okay. Well, we're running $70,000 of revenue, so maybe a little bit of money is a good idea if it gives them access to at least the restrooms or something like that. Okay, good.
If I can just weigh in, I was in the subcommittee meeting as well. It really is exciting. So many people are taking up paddling. I would just encourage moving forward on expanding the access to it, and at least making sure the reservation system keeps going up. Let's not wait till the next fiscal year.
Yeah.
Let's see if we can put this in place as you go into the spring and move forward. And again, because as you noted, paddle's more than paying for itself. So yeah, if we can just not be, wait till the next this year, let's grab this spring for people to use.
I'm thinking, Amy, that Steve's going to come back with us with a proposed budget before March, so we can approve the incremental expenses this year and get it done for this summer. So I'm hoping, Steve,
I'm
to
there.
get it done in the next couple of weeks and revise your budget upwards for this, and we can approve it in March when we approve all the budgets.
Yeah, that'd be awesome.
Not a
Good,
problem.
great.
Be awesome.
Good, you'll have more access. Good, more users.
And,
Okay.
and does that mean you can do some more clinics and stuff like that? Because I think there's demand on that as well. Because the clinics more than pay for themselves, right? By which charge people.
We make money on the clinics.
So, and I think there's demand for that as well. So that'd be great to.
Work on that too.
Okay,
I
good.
have to juggle some funds around. So,
There's a lot of money.
Thanks, Steve.
all right.
Steve, can I ask a question?
Sure.
Yeah, am I on?
Yep.
Yeah, Steve, what is the status of the cameras and the securities in all the parks? Is that moving ahead? Is that getting done, or is it?
Yes, it is. I know Public Works is working with IT. I know they installed the cameras. I believe the cameras got installed at the pool entrance and at the Lapham Road entrance on Tuesday. So, and they got the Wi-Fi going today with the IT department. They're waiting for Eversource because they have to replace a telephone pole on South Avenue in order to bring electric service over to the camera at South Avenue. But I understand that the cameras are functioning at the pool entrance and at the Lapham Road entrance. So,
And what about the other parks, Mead and Irwin? I'm not sure. Kiwanis might need it too. I mean, are we, anything that encourages people to be outside, including the, certainly this, it's just a really good idea right now.
I think
But they have to
Waveney
feel safe.
Was the first start, was the first project to get started, and I believe that there's some funding through Public Works to look at the other parks, but they're getting Waveney going first.
But is that going to happen this year?
Judy, that'll be in the DPW budget on the 23rd. We'll talk to
We
you
talked about that, but you
Right,
don't
but
have.
that's in Public Works. In the
All right.
parks.
I didn't know if it was in the police commission, if it's going through there first. Okay. Thanks, Tiger.
And Tiger, on the 21st, will that be?
23rd, George, sorry.
Sorry, 23rd. Will you be laying out a calendar, a schedule, or is that still being developed?
A calendar, a schedule.
For setting up the cameras in the other parks, as Judy was just talking.
We'll be discussing what we've done to date with you, and then what we plan to do at that time. But we consider security and cameras to be more of an executive session item.
Yeah, that'll be executive session item, guys.
Okay.
Thank you.
One other thing, Steve, congratulations to you and Tiger for thinking about converting a tennis court into 4 pickleball courts. I think that's a huge win-win for this town as well. And I just want to make sure, Steve, you said that budget for converting that is in Tiger's budget, not in your budget? Is that where?
That's in the parks maintenance.
Okay. And that's going to be done this year, Tiger?
We'll be discussing that on the 23rd.
Fantastic. I think that's a great idea.
Yep.
I agree. Great idea. Pickleball's exploding.
Yeah.
Sport of the future. Perfect. All right,
I
Steve.
have a question about the other classes and programs. I see it's going up to 225,000, a 4.7% increase, and I was just wondering what's driving that increase.
Well, the interest in our programs, for instance, we had 215,000 this year's budget, and to date, I've already spent 190. Around 198,000 of that money. So, the interest in a lot of our tennis clinics, some of our other activities has grown, and with COVID, and so we had originally had 247,000 2 years ago, and it got reduced down to 215,000. But the interest is there for programs, and so that we added additional money to cover the cost of tennis clinics and things that people are participating in.
But you make, these clinics and stuff, it's not just an expense, there's revenues that come in off of it. So it's as you go forward, the fact that if you can do a program that brings in revenue, even if there isn't a specific number lined up for it ahead of time, you're more than paying for it. So you know,
Right.
we don't want you to not put a program forward that you're going to charge for just because it's not in a specific line item.
Right. That's right, Amy. And we should get, Steve, you get a lot of credit for increasing guest fees from $5 to $10 and increasing our revenue. That's, you know, you did that quietly, but I think that's a huge benefit and shows your return on it of 1.56 per dollar spent. It's a great investment. And it also encourages people to be more residents. And if you want a guest fee, you want 3 people to play paddle with you, that's $30. So I think kudos for you for increasing that guest fee as well.
Good. All right. Any other questions? We're gonna move on to the pool if you want. Waverly Pool, again, we had a COVID season. We didn't get open until the 17th of June, but we restricted it to residents this year. We did not sell any non-resident passes. And we had over 979 passes sold this year. And the state had certain restrictions on capacity, how many people could be at the pool at any given time. And fortunately, when we built the pool, we put a big lawn around that surrounded the pool deck. Everybody sits on the lawn, so we were able to accommodate our residents throughout the summer. We had a despite the COVID restrictions, we had a great summer. We did really well. The pool, the exciting thing about the pool is that in fiscal year 22, in April of 22, the last bond payment is due, and the bond will be paid off on the pool. So that's it's set up as everybody knows, it's set up as an enterprise fund. So all the revenues from permits and fees go into the pool, so it's self-sustaining. And
Hey, Steve, I always forget. Well, and who pays the interest for the bond? I always, does a pool pay the interest and the principal on that payment?
Yeah, the way it was set up, it was originally set up, it was that the pool fund would pay the principal on the bond, the town would pay the interest. The first 5 years of operation, the pool paid everything, and then they discovered the town wasn't paying the interest, so the town started paying interest after the 5th year. So.
Thank you. And as you are going into this summer, are you, I know it's hard to say what's going on with COVID. Are you expecting to go back to more, what are you expecting to do in terms of the hours of the pool and, you know, what, or you're just going to wait and see how things shake out, which was reasonable?
We ran our normal pool hours last year. It just that there were restrictions on use of the locker room. People couldn't take showers. They had to come dressed to the pool and leave. They couldn't change. We couldn't use a changing room or to change. So those are the restrictions the state set up. Hopefully those will be relaxed somewhat. We'll be able to get back to normal summer. Okay. Other than that, we ran a normal pool. We had the pool open normal hours. We had the snack bar open, and so it all worked out very well.
Right.
The next slide is, I guess, our capital request for next year. The first item we were looking at is trail maintenance, and we've done a lot of work on the trails. We even know people walked them, but we worked with Keith Simpson Associates with Tiger, and they addressed the surfacing of the trails, which is more of a fine stone dust, and that's worked out very well. The main trail around the whole park has been pretty much done. The area through the cornfields, we added the additional trail in the back, which has really opened that area. The area along the Merritt Parkway needs some work. There's some washouts there, and there are two spurs that come off that come out to the park, and we need to address those. That's surfacing there. So we're asking for $30,000. The Waverly Park and Services has been a great partner in projects at Waverly Park, and they've been willing to supplement the funding from the town to get those areas done. So our trails are getting a lot of use. We were the first park to reopen in Fairfield County, I think, in the end of April when COVID restrictions were kind of lifted. We're getting a lot of use. People are walking our trails nonstop all winter. Even with the snow on the ground, there are people with their snowshoes or just trekking through the trails, cross-country skiers. So the park is getting a tremendous amount of use. Our trails are probably one of the biggest assets we have for joggers and runners in the fall, the spring, and the summer. So it's the trail maintenance is a big thing we need to do.
Hey, Steve, along with the trails, is there any way, and I know you mentioned that, you know, the park opened early and it certainly was a godsend for everybody. Is there any way, you had mentioned that you felt that you got really an exceptional amount of use from beyond just the New Canaan, that you thought it was a huge percentage of people just who were using the park. Is there any way to quantify that? You know, how much of the usage of the park is not directly folks from the town?
I don't know. Without stopping people to drive in and taking a survey, I think someone did that a couple of years ago. I don't remember who did that. An organization did it. We had some numbers on that, but that's how we could do that. I know that the Western Connecticut Council of Governments contacted me in the summer. They said that they're going to the different parks in Fairfield County, and they put a what do I call a deer camera up on the trail along the parkway, and they were amazed at how many people use that trail during the day. I think we were one of the busiest trails in all the parks in Fairfield County. So I can get you those numbers. I have some in a report they gave to us.
Okay.
The next item we had in our budget was the high school tennis courts. We have money in the current budget to repaint them. The problem is that the paint has started peeling up, and the contractor came in this past summer to look at it. He strongly recommended that we grind, paint up all the whole surface, all the concrete surface, reprime it with a primer, and then paint it. He said he's afraid that if we just treat the areas that are peeling, that other areas are going to peel unexpectedly, and we won't get the normal 5 to 7 year lifespan out of the paint job. So we're asking for $28,000 to come in and strip all the paint off the concrete surface, put new binder course down with a primer, and then repaint the courts. So that would be done this summer.
Can you remind us how old these tennis courts are? Because I remember we added the additional court. I mean, so did we get 5 years out of the original work that was done on those?
We got about 4 years out of it. They were done in 2017.
All right.
That doesn't seem like
it doesn't seem right. That
it doesn't seem right.
I don't know. The paint peeled, and the other thing is that there is I don't know if it's the way the water sheets off the courts, because if you stand on the court closest to the high school parking lots and you stand on the court close to the Waverly Care Center, there's a slope almost. If you ran to stretch the line across straight level, you'd have almost a 30-inch difference between the drops. So I think it may be the way the water goes across the courts with the rains and things that cause the paint to fail. I don't know, but what I think we gotta do is we gotta start from scratch, see what happens.
How do you know we're gonna have the right guy to do it? It's kind of like going to the dentist. You don't know if they did it right till 4 years later. But I mean, because it sounds like the guys who did it the first time, something wasn't done right if we only got 4 years out of it.
I don't know. We've got to come in, get it done correctly. We've got to take the paint off, start from scratch again. It may not have been prepped properly. I don't know. We have to find out.
So when you decide to bring somebody in, do you work with Tiger on that? How's that work in terms of figuring out the right guy?
We'll get prices from different contractors that do tennis courts. We'll get it done.
Yeah, but is it right?
Yeah. So, yeah, right. I mean, if
I don't have the answer to that. They just, they said, we can come in and we can paint your court, but you're probably throwing good money after that. So they said, come in, the way to correct it is to strip it, put new binder course down, reprime it, and put your 3 coats of paint on it. Right. And that's the best way to do it. The next item we have is the Mead Park tennis courts. We redid the walkways from the Mead Park Lodge up to courts 5, 6, 7, and 8. We have walkway that goes from the lower courts up to the parking lot where the tennis shed is. And we also have a walkway that goes from along the sides of courts 1 and 2 back to courts 3 and 4. And we, as an interim surfacing, we put road millings from the road when they resurface the roads down. And it's okay, but we like to have a consistent surface on all our walkways to the park, because some of the millings are slippery and people have slipped on them, whatever. So ideally, it'd be to pave those walkways. So that's $12,500. Athletic field bleachers, Waveney Park, we have some bleachers that are probably 25 years old. They no longer meet the codes. So the code says if you go above 3 tiers of seats, you have to have fencing around the top parts so somebody's will fall off. So there are 2 sections of bleachers that we need to replace. That's for $10,000. Athletic field fencing, we have fencing around the turf fields, and we have fencing around the backstops on the softball fields at Waveney, and safety fencing in front of the bench areas. And every year we have to go through and replace some of the fencing in front of the bench areas. It gets dented and bent. And some of the backstops, when the balls hit it causes the fencing to curl, so we got to replace some of that fencing. So that's what that's for. Lapham Center, they did some furniture replacement last year. They'd like to replace it. Some of the furniture has been used. Some of it's 15 years old, so it's time to replace it. That's $7,500. And Mead Park Colonnade improvements. We did the inside the white colonnades at Mead Park. We put a flagstone patio in last year, and we were able to put in a table with some chairs, and it's getting a lot of use. We'd like to add an additional table there. And in addition, where the old park garage was on Richmond Hill Road, the Tiger had a nice patio put in there, so we'd like to add a table and some chairs there because people are using it now for lunch and things. So we would that's what that $5,000 for put some furniture in both those patios. That's basically our capital request for this year. There was a lot of discussion last year about Kiwanis Park, and because of COVID, we had to put things on the back burner. We're looking into hopefully have a regular season at Kiwanis this summer. Some of the ideas we have are to bring some new additional programming which would make the public, this is a town more recognized of Kiwanis Park and what a great little park it is. Ideas would be to work with the library on a story time where moms could bring their toddlers down at 9 o'clock or 10 o'clock on a weekday morning, or maybe in the afternoon we have a storytelling time on the beach and they can go swimming. We could work with the nature center in another group to bring in maybe one day a week. We could bring in a petting some different animals or nature experience. They could see birds and different animals and pet them, whatever. We have a great beach volleyball court there. We talked about maybe possibly doing a clinic and see if there's interest in high school kids, maybe get some teams and do a beach volleyball type of competition. We could do some different kinds of activities and games there. Maybe a scavenger hunt. We thought about using the beach in a weekday morning and have adult yoga on the beach, which we could do. And maybe have a mom and tot yoga type of thing. So it's enjoyed by the residents of town. I mean, Exchange Club comes. We have a lot of activity in the summer. The playground is great. The Exchange Club comes there at Christmas time, the Christmas tree sale. The Girl Scouts have the Mary B cabin, which gets used year round by the Girl Scouts. We've had a request from the Boy Scouts because of COVID that they can't use the facilities of the churches. So we have the picnic pavilion in the back, and there's a request for them to use the picnic pavilion for some of their meetings on weeknights. So that may be another additional activity we can offer to the community. My summer camp goes there. The YMCA makes big use of their summer camps in the summer. Kevin's worked with them on a new lease, and that's for next year. There's just some photographs of different activities in Kiwanis. It's a great facility, and we were looking to add some things like maybe possibly a slip and slide type of thing, which might be fun for the middle school kids, and possibly a small water type slide that go into shallow water for younger children that they could use. So we're looking to do some additional activities that will increase the interest in Kiwanis and make it even more of a community asset for us that we have right now.
Hey, Steve, at the very bottom, you've got in the tiniest of fonts that the Exchange Club netted close to $140,000, a record. That'll go to 100% the local not-for-profit and community organizations. That's fantastic.
Wow. They do a great job, and they also they make a donation to the park of $1,500 a season for park for improvements there. So,
okay, questions for Steve. I know it's getting late, and
Steve.
Yeah.
Go ahead, Judy.
Are you cleaning up the pond this summer?
Yes, we will. It wasn't done
because
last
it was
summer
a little trashy. Yeah.
It wasn't done because of COVID last year. We had pond weeds and things, which we'll get rid of.
And what's the amount of time the residents can use it versus the Y? What's the agreement or arrangement this year? Has that changed?
We're all waiting to hear what the state regulations are going to be on camps. So that was the reason why the Y we took it over last year, because there were a lot of restrictions on the day camps. Hopefully we'll go back to a more normal camp season. The Y will continue to use the southeast portion of the park. The rest of the park will be open to the public normal hours. We'll be open 10 a.m. to 7 p.m. weekdays and 11 a.m. to 6 p.m. on weekends. So we'll have a regular season.
Because the little kids need a place to go. You know, that's a big deal. Yeah.
So we'll hopefully go back to a regular season. We're looking forward to that.
Hey, Steve, could I ask you, whoever's driving, just to maybe move the presentation off and so we can go back to the gallery view? Maybe that's you, Tucker, so that we can see if there are any questions from any of the board members. Amy, I think you had a question. Yep.
Yeah, I have some. Steve, can you bring us up to date on how the memorandum of understanding with the New Canaan Athletic Foundation worked out in collecting the per player use fee that we're going to set aside to help offset the cost of when we have to, redo the fields and stuff like that? How did that work out? Did we collect everything from everybody that we're supposed to?
All the sports, as far as I know, I didn't collect the money this year. The Athletic Foundation collected the money. So I would normally send a letter out to the organizations, and because it was John Howe had money in his budget, it was going to John's budget. Then when the MOU came out, the Athletic Foundation, they took over the responsibility of collecting the fees. So I gave them the information for all the organizations. They sent the letters. They collected the fees for the organizations.
No, but if I think the way it worked is correct me if I'm wrong, is that if you're running a program and you charge a fee for the program, then in that fee, you're supposed to charge the funds. I think it's $25 a person, then player or participant. And then that portion is supposed to be remitted to the New Canaan Athletic Foundation. Yeah. So did you collect that for everything, right? Flag football, everybody?
All the private organizations did it last year.
Did you collect it for the ones?
Did not do it.
Okay, you were supposed to, right?
We have to have money in our budget to do that.
You just are supposed to assess them enough money for it. So for some reason, your programs did not comply with the MOU?
No, I cannot assess the participants in my program as a fee if I don't have a line item to pay I can collect the money as revenue, but I can't pay it out of revenue. I have to have a line item in my budget to pay it.
So why wasn't that in? I mean, that was the understanding.
Because the budget last year was already proposed, our budget was already put in October, and the agreement that the rec department paid came out after the budget was already proposed. And that's why I didn't get their budget. The line item didn't get in our budget. The budget didn't get it.
Yeah, I'm sorry, I don't really understand that.
We'll work on that. We'll get it straightened out. I'm working with Kevin.
I don't follow that either. We have an MOU. I mean, it is what it is. So if there's been something that didn't quite happen, let's get it compliant.
Yeah, let's add it.
It's unfair if some players pay. It's unfair if some teams get assessed and some members participate and they pay it and others don't. And parents are fine.
That's not the agreement, Amy. Yeah, that's not the agreement. Yeah, that's right.
Everybody pays.
Amy, most of the MOU is to go for the repair of the turf fields. The recreation department programs have very little time in the turf fields.
That's not the deal. The deal is everybody who participates in the program is right. It's not just turf fields, it's the entire thing. So, if we did an MOU with the Athletic Foundation and we did it so they could try to help us enhance the fields and also put some of the money aside that we know we're going to have to pay, everyone's got to do it because that's the understanding. So I would like an accounting on that. I would like to know what happened.
Put a line item in my budget. Okay, well, I'll get it to you. But what do you want me to increase our budget by to do that?
Well, it's not really your budget. You just have to charge them for it.
That's right.
You have to have a line item to pay them.
Well, add a line item.
Linda, can you take a look into this? I don't know what the accounting issue might be, but whatever it is.
It should be an issue to add revenue.
Everybody's talking at once. Hang on. One at a time. Linda, can you look into this?
Yes, I'll work with Steve, and before you approve a budget, we'll approve the budget with all the accounting and the accounts in place.
Okay.
Great.
I just
Somebody else
need to
had a
get a
question?
number. Steve,
Yeah.
do you know how much you think you'll be paying out roughly?
Probably about $15,000.
Okay.
Okay. Did someone else have a question? Was it Chris or? Okay, okay, so we'll get that resolved. It sounds like there's a little glitch there. Okay.
My
Okay.
question, John, is that it's not a fair, the fee is not fair in that none of the school sports pay anything. They use probably 70% of the field.
Well,
Well, the school, I'm not sure. Anyway, we have an MOU that arranges how these things work. I don't, it is what it is, Steve.
The board head doesn't pay anything. We're getting charged. The board head doesn't use it. Doesn't pay anything.
Steve, no offense, you're not getting charged a thing. We are just asking participants in a program to contribute so we can keep the field. There's not one penny charged to the rec department. Zero.
I understand, but the biggest user of our facilities doesn't pay anything.
But
Why
that's
not?
Wait, Steve, hang on. Now, hang on. How can you say that the taxpayers in this town don't pay anything?
Yeah.
What do you mean? Those are the taxpayers. They're students. Their children are in those programs. They pay all the money. What do you mean?
So the kids in my program taxpayers.
Okay, we haven't. We are okay. I'm not sure if I understand the whole problem here, but we have an MOU that works with the Athletic Foundation on usage. That's just, I think, pretty clean and straightforward. Are we compliant with that or not? And if we're not, and there's a reason, Steve, Linda, and there's an accounting issue, it's fine. But the MOU's with the town. We have to do it.
I'll work with Linda on it.
Thank you.
Okay. Excellent. Okay. Okay.
Can I ask one other question? And I know it's a difficult question this year because it's been a tough year for everybody. We discussed about it, and this was pre-COVID, so I know it's all different. In terms of Kiwanis and the contribution they were giving to have access to Kiwanis Park. And I know last year was different, and we were talking about that it was very low. Do we know what the Y is going to be contributing? It was 5,000, then we were saying it should be higher. Do we know where that stands?
Kevin is working on it right now with the town lawyers. There's a draft facility agreement that the town lawyers is working on right now.
Right, and is it reflecting a higher usage fee for the Y?
It did. It probably will. Yes.
Can somebody give us an idea what you're thinking of versus just it'll come to us and it'll be done? I mean, what are we thinking of?
Well, I asked Rana and Steve what they thought. So Rana is still on.
I'm on. My suggestion was similar to last year, the $10,000 figure be the minimum. And my suggestion was 15 grand. And that's up from previous years where they paid 5 grand for 6+ years, which was a good setup. We all agree. Being that it was a COVID year, and I'm sure the Y hasn't made a ton of money and is, down as a lot of businesses are. Maybe we middle ground go back to 10. So keep it not to go below 10.
It'll be kind of for this 1 year, and then we'll see how life shakes out if we hopefully are back to a more normal situation going forward. Great.
Yeah, the one consideration is, the Y is really hurting financially.
I get it. I get it.
Be careful. Okay. Yeah. Other questions for Steve?
I'm just glad we moved Tiger off of tonight.
I told you, no one laughed. I said, we got to have Tiger. We need enough
too much.
Great call,
Thank you very much. I appreciate it.
It's great how much people use our facilities and the stuff that the rec department's done. We disagree on a couple of things, but it's very exciting how much the parks provided to us in the greater community, and hats off to everyone doing the work.
Oh my goodness. I mean, if you didn't appreciate it before, wow, right? This year was
now.
Maybe Steve, a question for you. How many pickleball courts should we have? I mean, I know that it's really taking off.
Well, we're talking about, there's a hard court at Mead Park, which is up above there. And
right.
Tiger has a proposal to come in and resurface the whole court because the base is broken up. So we couldn't put the surface down we had. So to come in and do a post-tension concrete court that would include 4 pickleball courts, and then there's still the practice wall for tennis, but you could also put a 5th pickleball court there if you wanted. I think it'd be great, and we can use our tennis bookings reservation system.
Perfect.
And people can make reservations. My tennis court attendant can monitor who's playing at what time and whatever. So
Yeah, that's perfect. It's if you haven't played, it's a very fun sport. I was kind of laughing at it until I played. It's a blast. Okay. All right. If there are any other questions, otherwise we can have a motion to adjourn.
Motion to adjourn.
Amy, okay. Second, Michael, all in favor? Aye, opposed, none. Okay. Thank you all again, everybody. Really good meeting. Appreciate it. Steve, thanks for going last. We owe you one.
not a problem. Whatever you need.
All right, everybody. Thanks.
Bye.